Well, welcome to the Focus Builder workshop. This is our very first workshop, and I'm really proud to bring to you some information that I think could be extremely relevant in your practice. So I hope that you learn a lot from this. I'm sorry that we couldn't be together live, but the benefit of this recorded workshop is that you will also have the ability to have a phone call with me or Dr. Jason Whitaker, and we can schedule a time to answer any questions that you may have as it relates to this information. So another cool thing is with this workshop you're getting this guide, this about 20-page packet of information as it relates to everything that I'm speaking today. And you'll see that this is the first page, but as we run through, we'll have information on all the topics that we're covering, so you can easily refer back to it. And I would suggest that you print this out as you watch the workshop, and that you can also write some notes and add some tidbits that we cover during the, but most of the critical information is in here. And so we get some really great things to cover. I think you're going to really enjoy it. And while we're here, I just want to give you a little bit of information too about the Focus Builder app. We obviously have 3 new exercises that we're going to cover today, and I'm super excited about that. You'll see that in my office here, I use a touch screen, so I can actually touch this screen and use the app through this touch screen. The only place, there's really just one company that makes this. This is called a Padzilla. Okay, we sell them, they're available on our website. There's no other option for that. Well, there is one option that you have that's non-touch feature, and it's probably the least expensive, where you can just get a regular TV, an inexpensive TV. You can actually plug in your iPad through this lightning adapter. You'll see this is an HDMI cable, and it plugs into the adapter, and that goes right into the iPad. And the other end goes into the TV. So you can do this, and a lot of doctors do that. The downside is that you lose the touch feature. But these Padzillas are kind of pricey. I think when you compare that to some other options in our field, they're actually less expensive by quite a bit, but still a good purchase. I find that it's worth it, and actually we have more and more touch features coming. And as you can see here, we've added visual memory, peripheral vision, Vergence. All these require a touch feature, and we're going to go over all of that. Now, before we start, what I'd like to do too is to give you some gems. I want to give you some unexpected gifts. I'm in my practice here. I have the benefit of having Skylar with me, and Skylar is going to assist today, and I'm going to show you just some of the clinical applications that I find are extremely beyond useful in my practice. They're not just useful, they really allow me to do as well as I can, and I feel like have the success that I've finally been able to have. For many years, I've tried to figure out how to integrate functional neurology to my practice, into my particular model. And the model that I have is kind of a mixed model, where I see a lot of regular chiropractic patients and some people that come in specifically for neurological care. And so I've been able to really see both populations and serve them well through a neurological approach. And a lot of times when the patient comes in and requires less time, and certainly doesn't want to spend the kind of money it might cost to get brain-based care, they're going to take less time than the patient that is coming in for neurological rehab. So I'm still going to do some kind of neurological application with those patients. I want to serve them well. I want to give them and deliver beyond what they're expecting every time. And so when I do that, I'm going to show you what I do to check those patients before I adjust them, what I do to prepare them for the adjustment, and sometimes I'll even just mix in different applications within the adjustment. So I'm going to give you some of those gems so that you can at least start implementing some of that in your practice. This is not the kind of setting where we go through a lot of cases, but I will still show you some cool applications that you can use in your office right away. So let's get started. Okay, I just want to show you guys another option here for in-office use. And you saw the screen that we use here, the Padzilla, but I also use this tripod, and I think this is probably your best option. There's other devices that will hold the iPad and you can move around. The neat thing about a tripod is it's more solid. So when you do touch features, you don't get as much wobbling of the iPad. So this is what it looks like on the back side. We've got this bracket here. This is the iPad Pro, so it's a little bit bigger. And so I really like this because it's mobile. We can move it around. We can adjust the height and everything. And then I think this bracket is called a Caddy Buddy or something like that. Let's see here. Caddy Buddy is what it's called. So you can look it up. I think it's right around $50 some for it. Another good option too, and I like this one a lot. The only thing is it's not mobile. You see this magnet back here. And it'll just stick right like that. So I often will just put my iPad there and leave it there all day, and sometimes I'll pull a chair up if I need for a patient to do some exercises. Obviously the downside is you can't adjust the height, so you might need multiple magnets to put it at different levels. But anyway, consider those options. I like to have all of the options because you just never know where you need to go, where you need to bring the iPad. You want it to be still when you do eye exercises, because if you're holding it, which you could do, but you want to be very still and careful, but if it's moving some, then it's changing the therapeutic application, and it may not be as therapeutic or not at all. So sometimes it's really, really important for it to be very still and to be at the right level. So anyway, these are good options to consider. There's I'd say at least two really important things that I like to do before I do any eye movement training or adjusting. And the very first one is to check for balance. And I like to use this pad. It's called an Arex pad. These are high quality. I would strongly recommend that you don't go cheap on these because it does make a really good difference. When patients come in, I throw this on the floor all the time and have them stand on it. Even regular chiropractic patient, I just want to see what kind of sway pattern they have, and that will guide me in what I need to do to prepare them to receive an adjustment or to start doing eye movement training. And the reason why is because if there's some kind of vestibular problem, that's really what I'm checking for. If there's some kind of vestibular imbalance, we can see that in eye movements, we can see that in balance. And we want to correct that before we do an adjustment and before we do eye movement training, because neither one of them are going to be as good as they can be with that kind of interference. The vestibular system is very powerful. It moves the eyes, it shifts muscle tone, it creates imbalances and postural tone. It makes changes in your posture. It makes it a lot harder to stand straighter when you have these imbalances. We want to fix all that before we do either one. I think it just makes good sense. And so I'm going to check Skylar's balance here. I'll go ahead and stand on the pad facing this way. And you could do quick, I start off with eyes open here. You can do just a quick check how they're doing with eyes open. Are they able to stand on there? Is there somewhat of a noticeable sway? But it's really with the eyes closed that you get the most information about the vestibular system. And he's doing pretty good here. I like to put my hands up like this because when I do that, it gives me some kind of reference point. I can see, is he moving closer to that hand or this hand or both hands or away? And that's really what I'm looking for. So go ahead and Skylar, close your eyes and hold still. Just try to maintain good balance. And what I'm noticing here is he went front left and then he came back towards this hand, and then there's all sorts of other compensations that happen after that. You can open your eyes now. Okay, so he went front left, then back right. And those are minimal shifts, and that's good. They're very, very important. It doesn't have to be huge. Now, when you see a shift that goes forward left and back right, automatically you think there's something going on with the posterior canal on the right side or the anterior canal on the left side. They're paired together, and this is exactly how they work. So we have got, if I can get these straight here, there we go. We've got a canal system. We have 3 canals on the one side, 3 canals on the other side. Okay, these are the receptors that tell your brain about angular movement of your head. And so if he's moving forward left You can see that left anterior canal right here is being activated. When he moves back to right, that right posterior canal is being activated. They're paired together. And that's, if you're not sure where he moved initially, that's okay. Just look at the pattern. Is it front left, right back? Or is it front right, back left? Or is it to the right? Or is it to the left? Or is it some kind of rotating pattern? Those are the big ones. And sometimes it's going to be just straight forward, straight back. Most of the time you're going to see an ellipse that goes front to one side, back to the other. That's the most common one. And so let's just kind of work through what we found here initially. He went forward left first and then backward right. If he goes forward left, especially in a healthy young individual like him, my thought is most likely that right posterior canal right here, this one, it's too active. If it's overactive, if its perception of motion is greater than normal, it's just not calibrated properly, then as soon as he closes his eyes, the brain's going to feel, oh, I'm moving back into the right. So he's going to pitch forward and left as a compensation, okay? And then he's going to come back into that posterior right position as a response. Now, what happens posturally here is that if the brain is feeling like you're falling back into the right, posturally, there has to be a forward left shift or compensation. But the muscle tension will be in response to the postural compensation. So you're going to see tightness on the back side of the neck and the trap, possibly the hamstring and the calf on that side, maybe the lower back or the glute. So that posterior chain on the right side. And sometimes it's just the neck, sometimes it's just the trap, sometimes it's just the lower back, sometimes it's just one of those areas. And what I think is the reason for that, because you would think, the calf would be maybe one of the first places you would see it, maybe the neck too, the neck and the calf muscle. But sometimes it's just the lower back. And I think what happens, wherever is the greatest level of stress mechanically, that's the area that will light up and symptomatically will feel worse first. So what I do in situations like this is I do an Epley maneuver, and I'm going to show that to you in a minute, and I do a ×0 ×1 strategy with the head and the eyes to affect the central component of not just the peripheral issue, but the central aspect as well. I just do them both. Now, let's just say, first of all, if before we do that, let's just say that he went backwards, okay? I saw that just a couple days ago in my office, and the patient just, eyes open, they're just falling back, and I have to catch them. So in that case, they just go straight back. There's no compensation, nothing. This was a recent concussion situation, and most likely in that case, we've got some aspect of central integration that's disrupted, and that certainly is not responding fast enough, right, or at all. And so this would be more of a depressed or hypo-functioning posterior canal system. Okay, I'm not being specific exactly where that is. There's some possibilities there. Certainly that junction between the cervical cord and the medulla is one common area, or midline cerebellum. And in those cases, you'll see some downbeat nystagmus. And if you see downbeat nystagmus, you want to really think about maybe double checking to balance if you're seeing that it matches. But the downbeat nystagmus, you can see it very easily on the right eye testing. So if you use the right eye system, on the horizontal pursuits, you'll see these downbeats. And I see those a lot, especially in people who've had TBIs. Anyway, in that case, we want to do something different to strengthen and habituate that posterior system. And I'll show you a few things with that after. But we need to know which direction they're going. Now, let's say, for example, that he was moving in a circle like this to the right. My suspicion would be, there could be a right cerebellum deficiency or weakness. There could be a right horizontal canal that's under-responsive, underactive. Those are possibilities. You want to compare to other exam findings. But Another possibility too is you could have just a direct side shift. So if he's shifting to the side like this, then you're thinking vestibular complex, cerebellum on the right side, most likely weak. Of course, there's other possibilities, but if I'm seeing a patient real quick that's pretty healthy, that's what I'm thinking initially, okay? So now what if the patient just go straight back and then they compensate and go forward? Well, if they go straight back and forward, their compensation mechanism is working. I think a lot of times you're going to see just a very small forward movement, if you even see it, and then they're going to go back and then compensate. So naturally, if they're going straight back, it's much worse. You don't let those patients leave until you've addressed the issue. That's a dangerous place to be when you can't catch yourself or respond to a posterior fall. If it's just a slight drift and back, then it could be that both posterior canals are involved, and in that case, we want to do something to really kind of habituate that. It could be that the vestibular function overall is down, and that's typically what we'll see. It could be a frontal mechanism that's deficient as well. What I like to do, if we get this posterior shift here, Skylar, I'm going to have you stand facing the wall over here. If it's even, both sides are just go straight back and forward, I'm going to have them walk down the hall backwards. And, a backward walk is a controlled fall backwards. Okay, so we want to get the system used to controlling a backward fall and really gaining that control back. And so I'm going to have Skylar walk back and just he's going to take 2 steps. When you step back, bring your arm up on the same side that you step back, okay? So just go ahead and do that 2 steps and then turn around and come back. There's 1 and there's 2. So turn around and do the same thing coming back. There's 1 and there's 2. Okay, now normally I would have a patient do that in a hallway and do a little bit more. I usually do somewhere around a minute of it. These are mostly healthy individuals. These are my chiropractic patients who come in and we do a quick check, we see that, I have them walk back and I recheck them right away. And if that sway pattern is better, and it typically is over 90% of the time, the patient is impressed before they even receive an adjustment. You'll see their posture change and improve right away. And then hopefully your adjustment will facilitate more of a change. Okay, so now that they've did this backward walking, they're in a better position to receive their adjustment. Now, let's just say that he was going back and to the right. This is what we saw earlier. The first thing I'm going to do is an Epley maneuver, and that Epley maneuver is going to be for the right posterior canal. So we're going to do that right now, and then I'm going to show you what we do right after the Epley to fix this. So let's go to the table over here, and just so you can see, this is the posterior canal, okay? You can see how slow, I don't know if you can see it clearly there, but how slow the movement of the otoconia is within the canal. It takes a long time to make its way all the way down. It's very slow. And so this has to be done carefully, and you can't do this maneuver quickly. There's just no way around it. So hold it each position at least 30 seconds. I like to go up to a minute typically, but if you don't have that kind of time, do 30 seconds in each position, and that makes a good difference. So here we've got the canal. He's going to turn his head to the right, and he's going to go down so that the canal's in its favorable plane. So there we go. Eyes are closed during this movement. And now that his head is in position, this posterior canal is in plane like this, straight down. And we're allowing for all these otoconias here to work their way down. And I typically wait about 30 seconds, like I said. And once they made their way all the way down at the bottom of the canal like this, then I'm ready to go to position number 2, okay? Now he may not even have BPPV. You know, we're doing this because we're finding that there's tremendous benefit in doing this even without this going on. But we still do it as if he had it, and that's how you get the most benefit from this. So okay, so you reach the bottom here. Now we're going to go into the next position, and eyes closed during the movement. They can open their eyes in between if they want to, but when you move the head, you want the eyes to be closed. So I'm going to slowly, very slowly move the head into position 2. So we went from 45 degrees to the right on the side of the overactive canal to 45 degrees to the left. And now what we've done, get my model here, is we shifted the head the other way, and now the otoconio is starting to work its way down just a little bit further. And after 30 seconds, I'm going to have him turn on his left side. So go ahead and turn on your left. And I keep his head real still. I've got my hands on his head. I don't want that head to bob around all over. And now that we're in position, I'm going to slowly turn the head so that he can face down towards the floor, tuck in his chin, and just hold that position here. If you're thinking that, wow, this would really lengthen my visit, I see my chiropractic patients, I say chiropractic, the ones that are here for spine care only, in 15-minute time slots. I can get this done within that time pretty easily. So again, it's 30 seconds in 4 positions. That's 2 minutes. It takes you 2 minutes to do this maneuver. Maybe add another 30 seconds for the eye head strategy. And you may not have to do this every time. It gets better very quickly, and you get to a point where it clears up sometimes after the first visit. Sometimes it takes a few visits of doing it. But the patients, I can tell you, Skylar's worked with me here in the office many times, and you just cannot compare the outcome to just skipping this part. It's so good that not only is the patient going to value what you do and recognize that you have their best interests at heart, and you'll do everything you can to make them better and keep them better, but they feel different. It feels great to have this maneuver done. It takes all that tension down, and a lot of times some of the things I may have adjusted, I've seen what appeared to be like neck subluxations, I didn't even have to address because we took care of this. So Skylar, I'm going to have you sit, and as you sit, keep your head exactly in the position that it is. You'll bring your legs in front of you. Make sure you keep looking down, keep your head real still, and stay in that position. So now, what we've done is we went all the way around, and now we're in this position, the anterior canal position here. And you'll see that the otoconio is just traveling, making his way all the way down to the end. So it went all the way around the canal. Okay? So he's going to hold that position there. And I'm going to make sure that he doesn't get out of position until I've done my times 0 times 1 strategy. So after 30 seconds to a minute, I'm going to ask Skylar to open his eyes and look at my thumb here. And you're going to follow my thumb with your head and your eyes all the way back and to the right. So we're going into that overactive canal position. Okay? And I often will hold the patient's head just to make sure they don't get out of position. Now keep looking at my thumb, and you're going to move your head side to side in a no-no position. Do that 10 times. So this is just small amplitude no-no motion. This kind of breaks that vertical plane, that unstable plane, by activating that horizontal movement. Now with eyes only, so keep your head there. Follow my thumb with your eyes only. Good. Keep looking at my thumb and bring your head down to neutral. Now the eyes are looking up and to the left. This is the left anterior canal position. We're activating it. The left anterior canal inhibits the right posterior canal. And now I'm going to have him do a yes motion down and center. So he's going down and return to center 10 times. And again, this is further inhibiting that right posterior canal. The vestibular ocular reflex is what we're inhibiting here. So this is bringing about a tremendous amount of balance within that system between the anterior and the posterior canal. Good. All right, this is the end of our maneuver. So right after that, I would probably encourage him to go walk backwards for a little bit, recheck his balance, and then adjust. So if he had a movement to the right, let's say it was an overactive, let's just say that we had an underactive right horizontal canal, We could do a barbecue roll where we might inhibit the left side. You just want to make sure that that's exactly what you're having. A lot of times what we find too is that you'll move into the overactive side because there's an initial movement in the opposite side and there's a compensation, and you're going to see the greatest amount of movement into that overactive one. And that's why a lot of times you'll see a lot of posterior movement, and I do the maneuver into that posterior, that excessive movement position. So again, with the horizontal canals, it could also go either way. I tend to start, especially with healthy individuals, I'll tend to move the head or do a maneuver into the canal that has the greatest amount of movement. Because typically you have a small compensation initially and then a bigger shift. So if it were a right canal, horizontal canal, what I would do is tilt the headpiece up about 30 degrees and go ahead and put your legs straight up this way. Okay, and I would have him turn his head to the right, close your eyes, and lie down on your back. This is position 1. He would stay in this position for 30 seconds, and then I would slowly bring the head to neutral. This is for an overactive right horizontal canal. And then we're going to keep it in neutral here for 30 seconds. And then we're going to go to the left. I'm going to go to the left here for 30 seconds. And then he's going to turn on his left side. Again, I'm stabilizing the head, making sure it's nice and still. And then after 30 seconds, we're going to go down, face down. So go ahead and lay down on your stomach. 30 seconds here. And then we're going to go back around another 30 seconds. So turn on your right side. So, and when I'm done, I'm either going to have him sit up from there or just turn on his back, depending on what I want to do next. I'm just going to choose to have him sit up. And he would end up being on this side. I'm just going to have him turn around the other way so that you guys can see. So with an overactive right horizontal canal, the central, the times 0 times 1 strategy would be follow with your head to the right, and then keep looking at my thumb as you bring your head back to center. Okay, then close your eyes, open your eyes again, follow to the right, keep looking at my thumb, come back to center, close your eyes. I would do this at least 3 times, and then back to center and close your eyes. Okay? Now, a lot of times you'll see, especially if you see tightness on one side of the neck, let's say if it were the right side, this little strategy can help to bring that tension down pretty rapidly, especially if there's a vestibular cause. Naturally, if he's subluxated and that's what's causing it, you might have to do the adjustment to resolve that. Now, this is addressing the majority of what you're going to find. And so it's very rare that I even have to do other kinds of strategies. Now, again, if they're falling back, you got to do more investigating because there's a lot more happening there. The injury level is a little bit higher, and the backward walking may work very well for that person. It works well for the majority of the ones I see, and there's some exceptions too that don't fit the criteria. But the next thing that we're going to do is a quick test, and so we're going to do an eye movement test. And in the Focus Builder app, we've got a folder in the saved exercises, and it's a testing folder. So into that folder, you'll go in there and you'll have the exercises or the test. We're going to run through them in just a second here and show you exactly how to test for that. Naturally, if you've got a right eye system or other technology to record eye movements, those are awesome and ideal to have. But if you don't have it, you can do a quick bedside exam, and then that is next. When you turn on the Focus Builder app, you go right at the bottom and save the exercises, and you've got a folder called Bedside Exam. If you click on that, this folder actually is being updated any day now. So that with your next update, it should be updated. We've added a few things I think that we're missing in there. Simply what we're going to do is we're going to test gaze holding on the horizontal, vertical, And we're going to also test slow pursuits on the horizontal and vertical, and then faster pursuits as well. And then we're going to test, we're going to do a right and left cerebellum pursuit test. So that's on a diagonal to the left, diagonal to the right. And we're going to basically be looking for any drifts there, any deviation off plane. And we're looking for the quality of the movement, how smooth it is. Especially when you look at pursuits, it's all about smoothness. And sometimes you can't really see or tell, you know, which direction the movement, the intrusion is, but you can just see that it's just rough. And sometimes it's just all you see at bedside. And that's okay. That's really great to note. We've got a, in your packet, you will have, okay, so you will have a sheet like this, a test form. And this is everything we're going to go through here in our bedside exam. Gaze holding, slow pursuit, fast pursuits, cerebellum pursuits, diagonal saccades, OPK, and I also added in the memory saccades. It's just a quick memory test that we can do to get an idea of how the patients are doing with that. So I'm going to run through the test. It should take you about 4 to 5 minutes to do the whole thing, so it's fairly quick. And actually, really quick, before you start it, you want to just get this little drop down on your iPad and put it on rotation lock. Rotation lock has to be on, because what we've done is we're going to do all of the movements on the horizontal plane when you look at the iPad like that. When we do a vertical one, it's still going to move horizontally. You just have to move the iPad like this. Okay, it's much quicker that way. So let's go ahead and hit, let's start off with our gaze holding. And what you'll see in gaze holding is that the target will start in the middle. So naturally the patient will just stare at it. And then it moves to the side like that. So he's looking at the side, and you're looking at his eyes as you're seeing that the target is holding and then moving back to center. And it'll move again to the other position. So you can see here. And what you're looking for is drifts. You know, is there any drifts, any beats, any kind of instability in the eyes there? Because they should be nice and stable and in position, both in the center, to the right, and to the left. Okay? And then the exercise ends. You hit complete, and it'll naturally roll from one to the other. So the next one is the exact same thing that we just did. But what I'm going to do is I'm going to put it on the vertical like that. So again, you look at the eyes, and you don't want to bring that iPad right in his face. You want to give him enough distance so he's not converging. But are we seeing any beats, any drifts, any kind of movement, any disruption at all in the stability of gaze? Okay, so this is a great way to test. And if there is, I would just say, okay, there's some movement. Maybe you don't know exactly, you know, was it a fast oscillation? Was it nystagmus? Was it saccadic intrusion? Or was it something else? You may not know, and that's okay if you don't. We're just looking for any movement at this point. Naturally, it is important to know, but at the very least, look for any movement. And if you have it, I would note, was it to the right? Was it to the left? Was it up? Was it down? Because if it's in one of those positions, you're going to want to really exercise gaze holding in that weak area. Okay, but what we're going to do is we're going to use something that works to fix it. And we're going to get into that in just a moment. The vestibulo-ocular reflex is our best tool in restoring gaze stability. So, and we'll certainly go through that in detail. So next is pursuit, and what you'll see is the pursuit motion is going to go straight across like that. This is the slow one, okay? And it's going to go across, and then it's going to come back to the other side. And you look at the eyes, you're looking for any intrusions. That's it. Is there any intrusion? It's quick. Is there any deviation off plane? And then if there are intrusions, you make a note of it. And ideally, you want to know where the intrusion is. Is it in the center? Is it to the right? Is it to the left? Is it throughout the entire movement? Sometimes you're going to see just at the ends or just in the center. And you might want to do some kind of therapy in the area where the intrusion is. And there's a number of options there, but for now we're just making notes, okay? We're not worrying too much about what it is. We're just making notes. Just jot down, yes, there's an intrusion. It's, you know, on the right or the left. Or maybe it's only while the eyes move to the right or to the left. So is the intrusion on the right side? Yes. Is it when the eyes move to the right or when they move to the left? You know, that could make a big difference. So just kind of note everything you notice. And Skylar is near perfect here. What a great subject. And the target here is moving faster. You can see that's a faster pursuit. Okay, so we're going to do horizontal pursuits that are a little faster. And you might find that some people are a lot better at one speed over the other. And this is important because especially with people who have attention deficit disorder, they hate anything slow. I mean, their eyes are just bouncing around all the time in all sorts of directions. And if you make them do gaze stability exercises or gaze stability test, or you have them follow a slow pursuit, they're going to hate it. And if it goes a little faster, they like it better. Naturally, if the slow one's not working, you might need a faster one to help them recover and improve the slow movement and progressively move it slower. Okay, next, these are the cerebellum pursuits. You see they're moving on a diagonal. So it's going up and down in this diagonal plane. And this particular plane is good for the left cerebellum. Does that seem right, Scholar? Backward, upside down, sideways. Okay, so that's the left cerebellum. And then the right cerebellum. Just a quick cerebellum test you can do with eye movements. And again, this is a pursuit, so we want to know, are there any intrusions in there? Is there any kind of movement off this plane? Is there a breakdown in smoothness? Because those intrusions can be so small that all you can see is that it's not smooth. Excuse me. All right, next, we're going to do diagonal saccades. The diagonal saccades are really great because we're going to do it to the right and to the left, so up right and up left. And these are really useful because you can see as the eye moves in its position, final position, from center to upright, back to center, and then up left, you want to see, is the eye moving initially more in the horizontal plane or vertical plane? Okay? Excuse me. Okay, and next is the OPK, so optokinetic. On the iPad, on this test, it's going to run in one direction. So I'm going to count for 10 seconds, make it go to the right, and up. So I do this 10 seconds in each direction. And what we're looking for here is gain. I'm looking at the eyes, and as they're moving, I want the eyes to bounce. You know, they go right, left, right, left, right, left, as they're following the lines. And I want that to happen right in the middle. It should be right in the middle when he goes to the right, to the left, up, and down. I'm looking for that amplitude of movement as well. And if there is, compare right to left, up to down, they should all be the same. And if for some reason, as the eyes bounce, they're kind of traveling more and more to one side and they're not recovering, then you know that the gain is off, and the ability to come back to center, that saccadic motion to come back to center on a rightward movement is impaired. If it's to the left, it's to the left. So we want to see, is the gain off right, left, up, and down? That's it. That's all you want to know initially. We're not going to overanalyze it. Is it right? Is it left? Is it up? Is it down? And a lot of times the verticals will be more compromised than the horizontals. Okay, so the last part is the memory saccades, and the memory saccades, they're not in that bedside exam. So you have to go to your sample presets. And if you run down, it's called memory test, repeat 4 times, okay? If I just start that, what I'm going to ask Skylar to do is just to look at where those targets appear. See how they appear? And he's at a disadvantage here because I should move the iPad around. But see how they move, they appear in 4 different places. And he would have to find where they were. And it's okay, we want you to get some correct and some that are not. So if it's wrong, it lights up as red, okay? And you've got to find that first one first. So go ahead and keep pressing around.
Somewhere over here.
Yeah, just press around until you get it. Okay, so there, he's got the first one. Do you remember the second one? Yeah,
There it is.
and the third one? I think it was down here somewhere. So no one was paying attention where these were. And then the next one, there you go. The score is 20 out of 4. So on your form, you could write down 20 out of 4 for the first one. And you do this 4 times. And this 4 times is good because a lot of times they may do it once and kind of get lucky. So you want to look at 4 tests. And this is a great way to kind of test that short-term memory in this quick bedside exam. Okay? And that's it for the bedside exam. One of our favorite topics this year in our seminars and also in our workshop, but primarily our seminars, is posture. I mean, I think we talk about posture regardless all the time, but I want to give you a little bit of insight and some clinical applications where you can really be respectful of the entire system when it comes to improving posture. So to have good posture, you need to have and posture and balance kind of run together. So, but you need to have a healthy integration between the visual system, the vestibular system, and the somatosensory system. Okay, so we want to do, so if you get a patient that doesn't have good posture, you want to look at all these systems. And I'm going to show you what I do to check them and what I do to address these problems. So on the visual side, we're going to talk a whole lot about that when we go over the app and all of its applications. We've already done some testing. We went through the bedside exam, and with the bedside exam, it gives you an idea of where the problems are. You may not necessarily know exactly what the actual cause or why the problem's there, but you know that it's there. Okay, so that's a really good start. And the bedside exam is one piece of what your entire exam should be, but it's something that you can do kind of quickly too sometimes if you just want to look at that one little aspect in your patient's presentation. So we'll look at the visual system a little bit later. I want to show you what we're going to do too with that somatosensory system. And in this area here, we're going to fit in the chiropractic adjustment. And I'm also going to show you some strategies too that are involving the vestibular system as well. So while we're standing here, let me just show you quickly. This is a great times 0 times 1 exercise that I love to do. I do those a lot with especially the patients that have lost the cervical curve. They don't have an ideal cervical curve. Maybe they have more of an anterior posture. It could be that the curve is good, but their head is postured more anteriorly. And this is a great strategy that helps to address that. Now, from a visual standpoint, saccades, pursuits, gaze stability exercise, all have been demonstrated to various studies to be beneficial for posture. Even vergence exercises, I've done numerous times in clinic here. I'll have a patient that have especially an imbalance in the A to P plane. You do vergence exercises, especially if they've got either a convergence insufficiency or divergence issue. You fix that problem and their balance improves, their posture improves. So that's important to not to quickly kind of run by that. It's so valuable and important. And the cool thing is a lot of times I'll do a vergence exercise as they're standing, I'll have them stand and then get on the pad, and it'll be better immediately. So that's another great little gem. So with this ball here, this is called an exerciser, and it does give you some feedback here. But what we're going to do is I'm going to have Skylar stand right here. So Skylar, your head is going to be right against the ball, and you want your feet to be slightly ahead so that you're leaning back into it some. Okay, perfect. Doesn't have to be a significant amount. Now, and I'll let you hold the ball there just so that you can be in control of that. Now, you can use just a cheap little ball, that has some give for home. I have patients buy them at Walmart and places like that. And basically, what we're going to do here is, let me just bring this down here so you don't have to hold it. Is that a little bit better?
Yep.
Okay. So I'm going to have Skylar look at my thumb here, and he can do this to himself. I mean, he can use his own thumb. Use your own thumb like that, because if they're going to do this at home, then they need to do it by themselves. Follow your thumb all the way up with your head and your eyes together. Okay? And then hold it right here and bring your head back down to neutral. Okay. And close your eyes, and you will repeat that. So go ahead and do it one more time. And then bring your head back down to center and close your eyes. Okay, good. You can step away. Okay, so the reason why we do this is because naturally I would want to check their balance first. And if I suspect that those posterior canal system's overactive, and it's very common, you're going to see more of that than anything else in your practice, then this exercise is great. Now, we're combining an isotonic exercise where they're applying pressure with the head, engaging the extensor muscles, and they're extending the neck. You're actually reconditioning the muscles that maintain that healthy extension and C-shaped curve, lordotic curve in the neck. But while you're doing that exercise, you're also doing a time zero back to kind of calm down that overactive posterior canal. If these posteriors are overactive, you're going to want to shift your posture away from them. Okay, you have to have a postural response. So if we're calming them down by going back, and then we are activating the anterior canal system and its vestibular ocular reflex by keeping the thumb up, and you're looking up at it while your head comes down. Now you're in this anterior canal position, and you're also suppressing the posteriors, because when the anteriors are activated, posteriors are again suppressed. So suppress posterior, while you're doing an isotonic exercise for your neck and reconditioning those neck muscles all in one. It's really amazing. It works really well. And again, patients love that too. So that's a great tool. Now we've done the Epley maneuver. Just imagine this. We've done the Epley maneuver. We've done the times 0 times 1 maneuver right after the Epley. We get up here. We do this neck condition exercise to improve the posture and muscle tone in the neck, and hopefully shift and improve that curvature. Now, what we could do, another quick little adjustment that is so powerful. Skylar, I'm going to have you stand with your back against the wall. Now, I had to give credit to Advanced Biostructural Correction technique here, the ABC technique. That's where it came from. It's a first rib adjustment, but you do it through the clavicle. And the way that it's taught, keep your shoulders all the way back like that, is you tissue pull up to the clavicle, and right near that that junction of the clavicle and the sternum. And what you want to do is maintain a tissue pull, and you're going to do a very firm contact like this. I mean, it feels like a punch, but I've done this with even elderly women that have very poor posture, and they really love it. Now, I'll show you how I do it most of the time, and it's not like this, because this is, I think for some people, they don't like having that hit there, but I do it on my fingers, just like this. So I tissue pull up, and I make the contact upwards, so it's inferior to superior. What I like to do, and you can do this on both sides, by the way, left and right. I like to use the arthrostem, and I'll put the arthrostem right on it, and I'll do it with inspiration. So go ahead and breathe in and breathe out. Breathe in, breathe out. Breathe in and breathe in. I'll do at least one time, but most of the time I like to do two. They both work, really. So, Skylar, go ahead and step away. Does that feel any different?
Yep.
Yep. Immediately, they'll feel straighter. You know, shoulders just pull straight back. It's so effective. And so, other adjustments that are great for posture, but also breathing, and I like to do those a lot. I'm going to go ahead and have you face this way. Just scoot down to your left a little bit. I like to do decompressive adjustment where we decompress the spine. Patients love it. It feels great. You know, we're used to having all that compression, but it also helps with posture immediately. And it's a non-painful adjustment because you're pulling vertebrae away from each other, and facilitates breathing, posture. I like to do those a lot. So what I'll do is I'll just kind of scan the spine. I look for any areas that may be protruding or fixated. And I've got one right here, right in the middle. And what I like to do is have the patient bring their hands behind their neck and bring your elbows forward. Now I'm just going to have you slouch forward a little bit just to kind of bring out that area that I want to adjust. And relax your back. And I like to move them a little bit, just that kind of gets them to loosen up. And then I'm going to ask you to go ahead and look up towards the ceiling. Just like that. And we had a huge release there. The timing is everything here. I'm doing this as he's moving in extension, but I'm also doing it as soon as I feel like the muscles are relaxed. If I feel like he's fighting me, sometimes I have to do it while the patient remains in flexion. See, I think your initial balance test could be very helpful here, but I have some patients that have this posture and they're very, very stiff here. And if I get them to extend, it makes it worse. I can't get any release. But if I adjust them in neutral, it works better. And sometimes I have to adjust them while they're flexing or while they're extending. You just may have to kind of play around with that, but you may have to do one or the other. Now, another really powerful adjustment, and I see this a lot, and patients love this, is the T1. You'll often see, they'll complain of, some tension in here, right in this area, and you'll find as you palpate both sides of T1, one side may be a little bit more tense, and I'm feeling the right side right now. That right side is just clearly a little bit more tense. I can actually feel the TP, kind of sticking back on that side. And before I do an adjustment on that T1, I'm going to do an adjustment on the opposite side on that first and second rib area. So I'm going to get right under the clavicle. And so go ahead and turn around, face the camera. I'm going to adjust right here. So as I'm palpating those ribs, I can feel like that's standing out a little bit on the left. And before I adjust posterior on the right, I'm going to adjust anterior on the opposite side. Really, we're going to take out all that rotation. And it always makes the adjustment of the posterior T1 on the right a lot easier if I adjust the anterior first. So raise your arms like that. It's kind of like the rib adjustments that we learned. And those rib adjustments are done primarily to facilitate movement of the rib and breathing. Relax your arms. But this is really to take out that rotation in the thoracic cage. So relax your arms completely. And I'm going to have you take a deep breath in and breathe out. And now I'm going to have you breathe in and look up. Okay, very good. So we get good movement there. And then we're going to go to the table and adjust that T1 posterior. So we're going to adjust the T1 on the right side, and it's really important now that we've done all this work to get ready for an adjustment. We checked balance, we checked eye movements, we balanced out vestibular imbalances. We've done a little bit of an exercise to help bring about some balance and muscle tone. So I'm about to do an adjustment. So I want to make sure that the position that he's in will really help me and assist me with this adjustment. So I'm going to have him bring his right arm just by his side so that it's neutral. There's the least amount of tension in here. I want to adjust that T1, and I really want to help him. I want all the help that I can get to do a really good job. So I'm going to use these pads to really bring that shoulder up a little bit. And that also make a big difference because when the shoulder rolls forward, it gets a little tighter in here. And there's a couple different ways you can do this. So I'm going to find that T1, that posterior T1, and you can use your thumb right on that transverse process near the body of the vertebrae, and I can just have him turn his head all the way over like this. Okay, and I can just, as I ask him to relax that right side, I can feel when that relaxation happens. I'm just going to apply a little bit of traction actually this way just to kind of decompress the spine and adjust directly with my thumb straight in. That's one way to do it. Another way to do it, and this is probably the one that I use the most, is I'm going to actually use just this part of my hand here and my finger, and I'm going to get in there because I really want to drive posterior a little bit more. I'm a big fan of that posterior line of drive. I feel like it's very effective and powerful, and I can get it better this way. So here I am, there's my T1. Just relax your neck. We're going to just bring it over like that. And relax that shoulder as best you can. Keep it real loose. And as I'm extending here, I'm kind of getting a feeling of, is he really relaxing? If he's not, I may actually just bring the head back to center and bring it back over. I may do that a few times because this kind of helps the patient know this is what we're doing. And relax that shoulder as best you can. And when I do my adjustment, I adjust down and in directly into the spine with a fair amount of P to A motion. And that went really well. We got a good movement there. So you can go ahead and come on up. And we'll just turn on your back actually. So the next thing that'd be really great to show you is what we do for the sensory system. Part of what we just did with an adjustment, especially this T1 and taking out the rotation in the upper rib area, will change their posture immediately. They'll breathe better, they feel better. It's an immediate difference. But we also want to make sure that the sensory mapping system is accurate, because if it's not, then that's going to work against them in maintaining good posture and good balance and good movement. And so this is a really awesome strategy here where, as I initially want to test, I may just use a point localization test and say, Skylar, touch the spot that I touch here. And I'm looking for accuracy. And, you know, it's normal higher up in the arms to be a little bit off, you know, maybe the width of a fingers. But I still want it to be as accurate as possible. Now, if we get down near the wrist or the hand and he's really missing, then we know we want to focus on it. Now, you may say, well, he went like this and then corrected, but he got it. You know, yeah, but these little corrections, those are positive signs. We want to make sure that he can go right to it fairly quickly. And if he's hesitating, or if he's touching and then correcting, those are all positive signs. And so what I'm going to do, there's actually a lot of different things you can do with this here. One option is you could just do tracing of the hand. So you could do tracing all around. You can use like a Q-tip or something like that. I'm using my finger right now. So you go all the way around like this, and then you go out. You go all the way out through each finger like this. I do this a lot with especially my autism cases because they're not able to respond properly. If I do some kind of point localization test with them, they don't know. You know, so this is fully passive. And then I'll do the other side as well. I'll run out through each finger like that. And I'll do each limb like that because all their maps are off with autism. But really in your regular patients, if these findings are off, you want to make sure you address it. Now, after I've done the sensory component, I want to do something for the proprioceptive system. You can do adjustments. You can do figure eights or circles. So what I can do here is I would initially start at the shoulder, and I'll do 10 of these. You can do 10 at the elbow, just circles or figure eights. You can do 10 at the wrist and each finger as well. And this feels good too. You know, the patient is kind of improving their connection with their body, their awareness of where each body part is through proprioceptive input and light touch sensory input as well. Now, another great way to do this, and we obviously would do that with every limb or just the ones that are involved. So a lot of times you may find that they all are involved, or it could just be one side of the body. It could just be the upper or lower body. Now, we can use the visual system to our advantage here. I didn't do that just now, but we can, and that's ideal. So another way to do this here, I'm going to have you sit, actually. Sit facing this way. And so what I would do here is I'll say, Skylar, close your eyes, and I'm going to touch part of your arm. Okay, and with your eyes closed, shift your eyes to the spot that I'm touching. Okay, and then open your eyes. Okay, and then close your eyes, and now touch the spot that I'm touching. Okay, and back to center. All right, so we could do that at multiple spots. Now, ideally, you want to position the head in a position so that he doesn't have to move it. Maybe I could bring the arm a little higher so that it'd be more doable for him, so that he's just moving the eyes. So when the eyes look at the spot that we made contact with, that I touched, he's making the best guess of where to move the eyes. And if he's wrong, when he opens his eyes, there will be a correction. You might be able to see it. But then you close your eyes, and then you want to touch it with eyes closed. So you're using the visual system, you're using the saccadic system, and you're using the motor sensory system as well. So you're kind of combining all those maps together. This is really probably the best strategy that you can do. And you can do that all the way through the arm. You can do that on both arms and both legs. And this is extremely effective. Now, for patients who've got, they've got neuropathy and they've got some sensory disturbances, those types of exercises where you're recruiting the visual system, the motor system, to help restore that sensory map, it can go a long way and can help them tremendously. Now, another thing that's really valuable, and sometimes they may just have stiffness, an ache, or a pain, or they've had an injury, let's say in this case in the arm. And I have patients who maybe they have stiffness, and we did everything else we knew to do to bring that stiffness down, and it's not working. So one thing that works really well is sometimes what I'll do is I'll have you close your eyes, and I'm gonna draw a shape, okay, with your arm. Tell me which shape this is.
Circle.
Yeah, and actually go ahead and lay down on your back. It's a little bit easier laying down. Okay, so shapes are easier. Okay, shapes are easier. We can do numbers. Okay, so I could say, okay, Skylar, which number is this? Okay, tell me which number this is.
3.
Okay, we can do letters, and we can do that with the proximal joints. We can do that with the distal joints. We can do that with the fingers. We can do that with the hip, with the ankle, with the toes. So you can really do that depending on where the tension is. I've had situations where, patients feel like their knees are kind of buckling every once in a while. They're just not maintaining good stability, and it feels tight and stiff as a compensation. That's just one example. There's lots of examples. But really, any kind of situation that you're working through, you can apply this kind of strategy, and you'll be really impressed to see how incredibly effective it is. And you can position the patient in a different position. So if you're finding they've got a really tight anterior compartment, let's say the right thigh, you can turn on your left side. And instead of just stretching like your regular stretching, I'm going to stretch, but maybe I'll ask him what number or which shape am I doing, So what number is this, So I'm picking number 3 again. What number is this? This is number 8. So the cool thing about this is that it's not just a stretch. You're including the brain along with your therapy, and it's far more effective. Not only is it more effective, but it'll hold a lot longer too. So let's go to standing. I want to just show one other quick thing, and then we'll be good to go with some eye movement exercises. So this is a Belgao board, and I just want to show you what we can do with this and maybe spur a little bit of creativity in your mind too, as to how you can do adjustments, because how the patient is positioned can make a huge difference in how well they receive the adjustment. And so in this case, back to our scenario, and I'll say the most common scenario that you'll see in your practice is, that posterior overactive system. Those posterior canals are overactive. You have this posture that changes like this. And so I'll bring this down, and I'm going to have Skylar stand on it facing this way. So you're going to stand at the end there, on the front of it right here, like this. Yeah. Okay. So his feet are on the front, and it gives his brain the impression that he is being lifted or pushed forward. Okay. And the compensation is to engage extensors. Having patients do exercises like this is really great for posture, just like backward walking is. One cool thing that I like to do sometimes, I'll have patients bring their arms out and do circles like this in extension. So they're engaging the extensors of the upper body. They're doing complex motion with the arms. Okay, good, thank you. Maybe you can have your patient like this while you do some eye exercises as well, and that could be beneficial. But you can do this too while they're getting adjusted. I talked about the clavicle adjustment, the SC adjustment earlier, which is really a first rib adjustment through the clavicle. You can do it this way. I can have him stand here, pull your shoulders back, and I can get those. I can do that standing decompressive adjustment like this while they're on here. So place your hands behind your neck, bring your elbows forward, relax your shoulders, and look up. Good. And so you can get creative with that, but I'm positioning him in a position to favor a change in posture while we're doing some of our other applications. Obviously, I'm doing this with patients that can handle that level of stimulation, so always be mindful of that. Okay, so I hope this is helpful for you. There's lots of little tricks like this that you can add in. I'm going to show you one more thing, and then we'll go ahead and move on with eye movements. So I just want to show you a clinical application that I used for a number of patients recently that have had complaints of neuropathy in their legs, in their feet. And this has worked well, especially with the ones who complain more of tingling. And so what we do here is his feet are in the water, and I put a little bit of salt on each side just to improve conduction. And this device is made by Zetec, and I use the frequency of 9, and the intensity I just go up so that he can just barely feel it, just lightly feel it. And that's where he is right now. So I'm going to leave it just like that. And we're going to do that for about 15 minutes. But in this particular case, I had found in a patient that they had a left pons weakness or deficiency. So I found a soft lesion there. And I wanted to combine an eye strategy and also more direct stimulation to the pons on the left with this all at the same time. So this is how we did it. So I'm going to use, this is just an insufflation bulb, okay, attached to my otoscope. And I'm going to use insufflation on the left side here in his left ear. And this is thought to have an effect on at least 2 or 3 cranial nerves that we think of. You know, there's the cranial nerve 5, potentially 9 and 10 are also affected there. So it's really great to activate, especially that left pons or that pontomedullary reticular formation on the left. So I'm going to do this on the left, and while we do that, we're also going to have him follow a moving target pursuit motion to the left. So when we pursuit to the left, we activate the left abducens nucleus, and this is a great pons stimulation as well, and it's really matches our findings. So I'm going to go ahead and do the insufflation at the same time. And I'm going to do this for the duration of, you know, whatever I determined was effective for this patient. In general, what I do is I'll match it to the eye movement. If I feel like maybe 10 repetition is ideal for the entire duration, I'll do the insufflation. And even if I only did a few sets of this and then stop when I'm done, I'm going to stop the exercise, and I may let the patient continue to do, you know, the stim and with their feet in the water there. The water is just a great conductor, and if we put the entire foot in there, instead of just putting little electrodes everywhere, we're getting the entire foot and lower leg stimulated. The effect on this can be, some people notice a difference immediately, some people notice it within days, but it's been really amazing. I mean, it's really surpassed my expectations. And if you combine, and this is really our objective here, we want to combine therapies together so that the entire system can work together a lot better. So I hope you find this helpful. There's other ways to address neuropathy. This is one thing that I've done and I thought that you might learn from and enjoy seeing. Now that we're going to dive a little deeper into the app and the eye movement training, one thing that's important to consider and to be aware of is that we have 6 major eye movement systems. This is in your notes, so you can pull that up. And we have, of those 6, we have 3 that hold the image steady on the retina, and we have 3 that direct the fovea to an object of interest. Okay, so the first 3 are the fixation system, the VOR, which is part of the vestibular system, and the optokinetic system. So the fixation system will basically hold an image steady while your head is immobile. Okay, so the target is steady and you're steady. That's the fixation system. The vestibular system is to hold a target steady while you have brief head movement. Okay. And then the optokinetic system is similar, except that it's for sustained head movement. And you'll see that more so like if you're in a car. The car is constantly moving. You know, initially you move and the vestibular input, the canals perceive that movement. Maybe the otolith will perceive that more linear movement. And then they kind of quiet down some, and the optokinetic system kicks in. So if you have that sustained motion, and let's say you look outside and you see, oh, look at that nice tree or business or person, and your eyes kind of fixate on that object, and you're driving by, and then you have to refixate on something else. Okay, so that's the optokinetic system. And then we've got the other 3 systems, the saccadic system, smooth pursuit, and vergence. So the saccadic system, very simply, will bring an image of an object rapidly onto the fovea. So if you're looking at one object here and quickly looking over here, that's a saccade. It's fast. It's just faster. The pursuits are slower. You know, that's more of a slow tracking. Okay? So you're going to hold you're going to hold the image of a small moving target on the fovea. I may be following with my eyes like that. That's a pursuit. The difference is speed, okay? Now, there's also a strong relationship with the pursuit system and a gaze stability, or the gaze fixation system, because a pursuit is really gaze fixation in motion. Now, when you start going a little faster than 30 degrees per second, then you're starting to recruit saccades. And in the Vergent system, that's when both eyes move in opposite direction, but to keep an image clear, so you want to be able to see clearly as the eyes move, not in the same direction, but opposite. So that's near and far, near and far. Okay, that's the Vergent system. I put this image in here to kind of give you an idea of how important the peripheral system is. We don't talk about it as much as we do the central. A lot of our therapies are focused on the central system. They have different responsibilities. Obviously, the peripheral system will pick up movement a lot better and a lot quicker so that you can have a stronger reflexogenic response. But the central system is really, it's at 5 to 8 degrees is all it is in your visual field. Everything else is peripheral. So we'll talk about the peripheral system because we've got now a new exercise that is involving and addressing that peripheral system. So we'll be able to cover that. But be mindful of that.
I think I hear this beeping. I don't want to lose any audio. Just remember where you are. I'll just dissolve into it. No, it's not beeping. I heard something beep.
Okay.
You know where you are?
Yeah.
Okay. And right there, look at me, and then turn into your...
Okay. So you want to be mindful of that because since... let me think for a second. Where was I?
I'm so sorry.
I think you're right at getting out of talking about just the 5 to 8 degrees of central vision.
Oh, okay.
And getting into the importance of...
Oh, yes. I got it. Thank you.
I just want to make sure we don't miss
Yep.
this audio.
Yep. Yeah, so we got to be mindful of the fact that central vision is just at 5 to 8 degrees and that the peripheral system is better at picking up quick motion. When you're working with your patients, you're actually better off using that peripheral system to pick up any movement, and especially when you look at their eye movements. So you don't want to just focus in on one eye or the other eye. You want to focus right between them and look at both eyes with your peripheral system because it can pick up any abnormalities a lot better and a lot quicker. So use that clinically, but you can also use it therapeutically. Now, before we really dive in here, I just also want to suggest here 3 different conditions that I tend to work a fair amount with: dyslexia, ADHD, and autism, and how they have some pretty strong specific eye movement characteristics that are good for us to be aware of. So in dyslexia, it's pretty common to find that there is a pretty significant impairment of the fixation system, gaze fixation. And so therapeutically, if you see patients that have that, not only do you want to check it, but you might want to use that therapeutically to really exercise their gaze stability. And the way that we do it in general is we use the vestibular ocular reflex to reinforce gaze. So if I were to focus on an object, let's just say my thumb here, I would use a no-no motion or horizontal VOR where I move my head right, left, because as I move my head to the right, the vestibular system pushes the eyes back to the opposite direction. Okay, so we're using that system to improve stability of gaze. Same thing, you can do it in the vertical plane as well. And that's just a simple little exercise. You do a handful of those on a regular basis to stabilize gaze. We'll get into detail a little bit later, but you can do this not just in the center, you can do it to the right, to the left, up and down as well. Also, a common finding with dyslexia is their spatial awareness is off. So more specifically, the visual maps are off. And we have exercises that are specific to improving those maps, especially that combined saccades and pursuit on the diagonal are really great for that. But some kind of peripheral visual exercise or peripheral vision application is good too, where you're going to improve awareness of where things are in the periphery as well. They also have a difficulty with anti-saccades. So the anti-saccades, again, we'll go in detail in those, but if I move one thumb up, I would say to the patient, look at the side that I don't move, okay? So they would have to look in the opposite direction, okay? And so that's a great exercise for them. We have that in our app. And their saccades are generally inaccurate, so their ability to perform saccades is not accurate. So those are some general things that are good to be aware of. You can use that therapeutically to really improve in those cases. ADHD, think of speed and fast movement. They love fast movement. Generally, if you were to test saccades, you would find that their saccades, in most cases, are really fast. And they hate anything slow. Slow pursuits are just a bear and hard to perform. Gaze fixation is a little bit harder to do. The ability to do anti-saccade exercise is more difficult. Memory saccades as well are more difficult. So those are really great ones. Memory saccades are good to do because they slow down. The saccades are slower. Anti-saccades are slower than regular saccade as well. Your gap saccade has a faster initiation than overlap, so you might want to use an overlap feature. We'll go through that as well. Autism. I talked a little bit about autism earlier. The fixation and really all eye movements are generally off. All maps are usually off. And I love taking the maps approach for autism, where we do the sensory tracing, we focus on restoring gaze with VOR, and I really have to get interesting in maybe putting little stickers and different kinds of targets on my face, and I have to constantly change them up so they're interested in the target. And I like to do the gaze exercises. And a lot of times with those cases, I will have to especially focus on the horizontal movements. I'm finding, and I don't know, if this is across the board, but in my practice, I'm finding that most of the cases of autism have a harder time with horizontal tracking versus vertical. And maybe because that might have something to do with where the primary injury was, potentially, in the pons, maybe the inferior olive, but that horizontal system seems to be more compromised in a lot of the cases that I see. And you want to take some kind of image. You can pull up a picture on your iPad that's really interesting. And I use the visual following system quite a bit there, where let's just say, for example, here, let me just get a picture that I might use. If you go online with your iPad and you look for images, and you can do screenshots and of all sorts of interesting pictures, and it could be anything from, well, let's see here. Get some fun kid pictures in here. Let me go to my albums. Okay, so it could be selfies, like I've done some selfies of myself, and what I'll do is I'll bring the iPad fairly close to them because I want it to take up the majority of the visual field. We're going to use the visual following system, okay? As opposed to looking at a small target, I'm finding that they're able to see, a big picture like that and move it on the horizontal. And a lot of times they're able to pursue. And so we start with something like that. Or maybe an optokinetic system, or something that works. You got to find something that works. But this is a really great one. So I'll do that. I'll do some no-nos, and then I'll do some visual following. And visual following simply means that the majority of the visual field is moving. And it's a lot easier to attend to something like that. And I might have to switch up the picture. I may have to find some kind of, a character, some kind of animation that they're really interested in, because that does make a big difference. The more interesting the target is, the more likely they're going to focus on it. And that's why in our app we've added the ability to load pictures as targets, and as opposed to just using the options that we have built in, you can upload a picture. Okay, so we've done all that. Gaze fixation. This is a great place to start. Again, the definition of gaze holding or gaze fixation is to hold an image steady while your head is steady. Okay. Now, if that system is impaired, we're primarily going to use the VOR to restore it. That's just our best bet, our best option. If that's broken, it's not working, you have to find something else that might work. And you may have to do pursuits or something like that, because you've got some gaze holding ability. But that's got to work too to use it. You always have to find something that works to fix something that doesn't. You also got to be mindful that impaired gaze fixation is non-specific. We can't say there's only one little area in the brain that's affected when this system's not working well. The options that you have here are, let's just say that gaze fixation is off, and we did our test, and we find that it's when we look to the left, that there's more of a problem. Then you want to make sure that you're going to do this VOR exercise, this no motion, when you look into this area that's problematic. You can also use this strategy if you're looking at pursuits and you're finding that there's intrusions, but they're really happening only in a very specific area. Let's just say it's just the middle. You could do a pursuit and stop in the middle and then do a no exercise. Or you can just simply do your gaze exercises and just do them in the center. Look in the center. And what I like to do, naturally we have a gaze stability application I'm going to show you, but what I like to do in most cases, I use this little poster, and this is dry erase. So sometimes I've had to draw really interesting things on there to keep the children's attention, especially. But these glasses here have a laser, and we can do laser guided. And the cool thing about them is that the laser is mounted onto the glasses, so you don't have to play around with making sure it's lined up right or in the right place. It's in the center every time. That way we can do our exercise and do the no, but it's laser guided. So that as you're moving, that you're moving on plane. So the options are, we can do a yes motion or we can do a no motion. Which one do we pick? Well, and we can do it while the eyes are looking in the center, or we can do it while the eyes are looking to the right or to the left or up or down. Which one? Should we just do them all? And sometimes, doing all of them is good and ideal. Maybe there's not a specific area that's more problematic, but they all are. Maybe the pursuits are rough all the way through, or gaze stability is not good in any of the positions, and you might have to do them all. I would encourage you to really reinforce the ones that are a problem first. But if you don't really have one, and you want to do this too as a simple exercise to benefit spinal health, because if you do gaze stability exercises for your chiropractic patients, let's just say while they're waiting, they come into your gaze stability station and they do their exercises, and they may do no-nos and yes-yeses, do a handful of them. I rarely, if ever, do more than 10 reps, but I often will start with lower reps. I might have them do center, right, left, and start small and expand over time. And so I'll have them do that. If the patient's healthier and have a greater level of function, we can do it standing. But the laser allows you to make sure that your head moves in the right plane. Because if you do a no exercise, but your head tilts with it, then your brain is not encoding a linear movement. So as you're doing this to improve stability in this horizontal plane, let's say the intrusions were moving your eyes, more to one side, then a no motion may be very beneficial. If the movement, let's say your eyes are struggling to the left, and you're doing this leftward VOR motion, so as I'm looking over here, you want to make sure that you're reinforcing on that plane, because this will translate to improve pursuit motion and saccadic motion as well. And so you want it to benefit. So let's just say that you're doing a horizontal pursuit and you got all these intrusions in there. Well, this exercise can help improve that smooth pursuit as well. Okay, so you want to make sure that it's linear and straight, and the laser helps with that quite a bit. If I find, let's say that you can see at bedside the direction of the drift, or you've got a system like a right eye system and you can see the tracing and you see the eyes, let's say they're moving down on the horizontal pursuit, you see these downward beats. Well, you can do a pursuit motion and stop. I'm going to go ahead and play that, but pursuit motion, stop, and you can do a anterior pitch exercise that pushes the eyes up in the areas where you're getting these downbeats. And the way that we do that, let me show you real quick, is you can go to this gaze stability feature in settings, and what we want to do, so let's see, reset all. So we'll start from remove all these. Okay. So what I'm going to do first is you want to add steps, okay? You want to add steps, and my first step will be right in the center. I want to start from the middle, okay? So I'm going to go to 5. And then I'm going to go from 5, I'm going to go to 6, okay? So I'm going to do the horizontals first. And you can select what kind of target you want, just like all the other options we have. And we'll just make it random. The nice thing about random is it keeps it more interesting. You don't know what the target's going to be like next, so it keeps alternating. And you can make that initial pause hold. You know, and so you've got some option of how long you want it to hold. And we can do tap as an option. That means it won't move until you tap the screen. Okay, so let's just select tap here. Okay, and we can control the final pause. So I'm going to keep that final pause here. We'll make that tap as well. Actually, I'm going to keep that at no pause, and the reason for that is because the next motion I'm going to put tap as the initial movement. And that way it'll just stay in position until I tap the screen, and then it'll start moving again. Okay, you could, if you wanted, if you knew that there's a specific amount of time that it takes your patient to do their gaze exercise, well, you could just put in a certain amount of time and it'll just start moving automatically. If you don't know, you don't want them to be rushed, then the tap feature is really great. Okay, so then we've got that, we'll hit done. We've got our first step, and we can control if we want these targets to be close together or further apart. It's just like our gaze chart right here. Closer together or further apart. So right now they're set at 50%. Okay, so you can do 50, 25, 50, 75, or 100. So we'll leave it at 50 for now. Let's just add another step. Now we went to the right, now we're going to go back to the left. So from 6, we're going to go back to 5. Okay, and we're going to do initial, we're going to do tap, it's all the way at the bottom, and no pause on the final. The pursuit speed is 5. So I decided that I was going to use pursuits from one point to the next. It's good to pick something that works well. So in your assessment, if you find that, you know what, their saccadic system works so well, maybe we should do saccades. Or the pursuit system works well, but the saccadic system doesn't, pick the one that works the best. Or the one that seems to be most beneficial. Maybe after a saccade, they have better gaze stability than they do after pursuit. I don't know. So those are options that you have. If we were to pick saccades, for example, and I usually do one or the other, but let's just say that we did express saccades, or with the gap feature, meaning one target disappears and the other one reappears. And I can pick how many movement I want between that eccentric position and that center position. So let's just say that I wanted to make it 2 movements, okay? And the amount of time between each motion, I'm going to make it, let's just say 3 seconds. We'll do 2.5 seconds. Okay. 2.5 seconds. Because maybe in this case, I've got these downbeats, these drifts downwards, and I want to do a yes motion every time, because maybe those downbeats are all the way through my horizontal pursuit. And so now just pursuit to the right, but I realize, I'd rather do a yes motion every time. So in this case, if we play this out, final pause, let's make it pause for a few seconds when it finishes. All right, so initially, if I wanted to save it, I would do save as, and you can save that and it'll go directly into your home folder. From the home folder, you can then move it to other folders, but everything you save goes in the home folder, and then from there you can move it to other folders. Okay, so we'll do it this way, just for so you can see what we have so far. So here I start in the middle, and I may do my exercise, I may do a yes or a no motion, whatever you determine is necessary, and then I'm going to tap, and I'm going to pursue all the way to the right. And now that I'm in this position here, it won't start moving until I tap the screen. So I'm going to do, again, my yes, yes motion. Maybe I have those downbeats, right? So I'm going to do a yes motion, that anterior pitch movement to push my eyes up. And then I'm going to hit tap, and you're going to see a target motion. And I'm going to do a yes motion, and move again, and a yes motion. Okay, that was kind of fast. But you want to give yourself enough time to do at least one movement. And a lot of times that's all I do, is just one motion, one high quality movement with each movement. Okay? Now, we can change those settings. We can keep adding steps so that we can go to the left as well. If we feel like that's necessary, we can go back to the center and then go back to the top and down. You can direct it in any of those positions that you want. So that's for gaze stability. Now, I want to show you too, I talked about saving an exercise. If you save it, it'll automatically go into this home folder right here. And if you want to move it to another area, you can, let's say, create a new folder. We'll do add a folder. Here's your new folder. If you click on it or touch it, you can change the name of the folder, and there's nothing in there right now. So let's just say I wanted to move something from my home folder, and I don't have anything in this one. Okay, so let's just say I want to move something from my sample presets, and I want to move, let's say, this first one right here, left parietal pursuit. Okay, so it's in sample presets, selected to move home, but I could move it somewhere else. I could move it to my new folder. Okay, and then I'll hit done, new folder, that's where it's going, and I hit done, and it moves to the new folder. Okay, now it's in here. I can rename this folder. If I wanted to call it just new, or NE, or just N, whatever you want, you can add. But there it is. So if I want to move it back, I can go here and put it back in my sample presets, and then done. And by the way, you can delete the folder right here if you choose to. Now it's back in my sample presets. So we did the bedside exam earlier, and you'll notice that this run-in sequence is selected. Run in sequence will basically make everything in your folder run one after the other without having to go back here, okay? And this is useful if you're creating a new folder and you want your patient to run through a sequence of exercises in order, it'll do that. Now, if you wanted to move things around too, you could. Let's say that you wanted to change the order that things are in. What you do is you touch the name and then you press on, hold it, and then move it down. And then it'll move it into a different position. Okay? That's how you can change the order that things are placed in. And then you can do run in sequence. And if I were to start here, it'll run through all of these. And when one finishes, you know, when one is done, let's just say, I don't know how long these are, but when it's finished, it'll say complete. You'll press complete, and then you press start, and then the next exercise after that goes. It's just like we had it in the exam. But again, I don't remember how long this goes, so we're just gonna zip through that. All right. So we covered gaze stability. Now, there's a number of different kinds of interruption in stable gaze or disruption in normal fixation. They're listed in your sheet, so you can refer to it. You know, nystagmus is an oscillation of the eyes. These are all different types of oscillopsias, okay? So sustained oscillation, but that's initiated with a slow movement, that's nystagmus. The saccadic oscillation is similar, but it's initiated by a fast movement. Saccadic intrusions are intermittent. They're these fast disruption of gaze. It can happen within a pursuit motion or just steady gaze. And they're intermittent. Sometimes they're there, sometimes they're not. You don't know when they're going to show up. It's not a sustained motion. Peripheral central vestibular dysfunction will certainly do that too. And that's why it's so good to look at gaze stability. And if you've got a right eye system, there is a gaze stability test there, and you can see, are the eyes migrating to down or to the right or to the left, or, you know, which direction are they moving into? And that gives you an idea. Is there potentially a vestibular imbalance that is forcing the eyes out of position? Now, you could see this too if you are with a patient and you just look at them in the eyes as you're talking to them. Just make mental notes. Are they moving their eyes down more than anywhere else? Are they moving to the right or to the left? Are there spontaneous movements in there? Or is there simply just a preference? They just, for some reason, they feel comfortable keeping their eyes over here when they're talking over there. This just feels right for them. This is where they want to be. That's valuable. You know, you might suspect that there's a vestibular imbalance and that's moving the eyes in one position or another. Down is really common. You know, a lot of people will look down when talking, and it's just hard, and maybe they'll come up and then they'll go right back down. You know, and that's, you know, again, it's really common to have that overactive posterior canals. They push the eyes down. When you move the head back, the posterior canals move the eyes down. When you move your head forward, the eyes get pushed up. When you move the head to the right, it gets pushed to the left, you know, and that's what they do. So if you've got this downward preference, you know, you want to use some of those strategies that we talked about. Maybe you'll do more upward movement exercise. Maybe you're going to do just an anterior pitch, yes, yes motion to really force the eyes up. You know, if you've got a preference to the right, well, you're going to use a strategy that will move the head to the right and the eyes to the left. So maybe your eyes will stay center and you'll do just a right motion, you know, just a right motion, just to force the eyes there. If the eyes really like hanging on that right side, you know, you want to use either a ×1 or a ×2 motion. A ×1 is, this is ×1. A ×2 motion, the eyes, as you move the head to the right, the eyes are going to move as well to the opposite direction. A ×1, it's staying fixed on there, okay? And then a ×0 is when they're going with it. So if the eyes like being here, we can say that the left horizontal system is stronger, right? Because when you turn head left, eyes get pushed right. That system is stronger. So we want to do a ×0 to suppress that system, and then we're going to do a ×1 to activate the other side. Okay, so times 0 suppress, times 1 activate. So suppress left, activate right. That's just a really good strategy to bring about some balance there. Okay, so that's it for gaze fixation. Let's move on to the next one. So the next system we're going to cover here is the optokinetic system. So as I mentioned earlier, its purpose is to hold an image steady on the retina during sustained head movement. But I think there's also another aspect to that. So as you see here in the purpose section, this system allows the eye to follow objects in motion when the head remains stationary or observing a stationary object with sustained head movement, either one. And so we use this quite a bit clinically. I'm sure that I think most people have seen these. The thing with the optokinetic system is if you really want to stimulate it, it has to be the majority of the visual field. Okay, it has to be the majority of the field. So these are not a true optokinetic stimulation. They're actually a combination of the optokinetic with the pursuit system kind of working together. And there's a pretty good relationship between those systems. They actually run through similar pathways. And so this is good for us to know clinically because we can use one to help assist the other. So when you use a tape like that doesn't take up the entire visual field, what you're doing is look OPK, not stare OPK. All right? So stare OPK is a pure reflex. That's the optokinetic system that we're thinking of. Look OPK is more volitional. All right, so you're engaging the volitional system. And as you look at these images here, you'll see that, the stare OPK is primarily a brainstem activation, very heavy on the mesencephalon, but also the pons. And then when you look at the look OPK there, if I'm going to the right, okay, so the direction that the OPK moves, that's the slow phase. Okay, you're tracking one of the red boxes there, and then you're quickly catching the next one. And so the slow phase to the right, fast phase to the left, that is a good right brain stimulation. So this is a right brain activity. How great is that? We've got something really simple that we can use to just activate one hemisphere or the other hemisphere, okay? And so obviously this would be right brain for me, as it's going to the right. So the right frontal lobe, the right parietal lobe are involved, the pons if you're doing that horizontal movement, and the cerebellum on the opposite side. Okay, that's just a great therapy. And so with the optokinetic system, I think another important thing I touched on earlier was the visual following system. It kind of is one of those reflexes too that is similar to the optokinetic system. The visual following is when you're taking an image that takes up the majority of your visual field and you're moving that and you're using that to improve maybe a smaller tracking. If patients can't track a small target, give them a big one, train with that, and then shrink the target over time. And so that can work well. I use that a lot with the cases of autism because their visual system is so off. My goal with autism is improve their maps, the accuracy of their map system, but also to restore gaze stability. Because if their eyes are popping around all over the place, when you saccade constantly, the moment during the duration of a saccade, you're blind. You don't see anything. Your brain has to fill in that information. If the eyes are constantly moving, my goodness, your visual system is not taking in a whole lot. And so from a learning perspective, it's not good. So I want to stabilize gaze always. That's first and most important. We've got to stabilize gaze. Even in cases like of autism that are so serious and so difficult to work with, if you restore the maps and work on stabilizing gaze, you'll change their world. They're perceiving totally differently. And you can kind of regrow those regions in the brainstem and in the brain that have been impaired. So the optokinetic system, let me show you Yeah, let me show you how we can use it, because there's a lot you can do with this. And I use these still, by the way. It's just, and you need to be aware that they're not a reflexogenic. It's combining the reflex with a volitional system. Okay, so let me show you what we've done in the Focus Builder app for that particular application. Obviously, it's right here. It's OPK. It's those classic red and white strips. Red, because red, you know, we tend to be attracted to red a lot more than other colors, and that's why we typically have these strips in red. But they don't have to be red, you know, and they don't have to be strips. They could be other kinds of shapes. So the direction of the optokinetic stimulation is all dependent on what you want to stimulate. If you do an optokinetic movement to the right, for example, so this one's going to the right, the red, they're kind of large bars. Let's make it go real slow. Okay, if it's a movement to the right, I won't do it too long in case you guys have some lesions. But let's say that it moves to the right, that activates the right brain. We can say that's a right brain activity. From a vestibular perspective, because this is a vestibular function, if the scene is moving to the right, that's as if you were rotating to the left, okay? So if you've got a left overactive vestibular system, especially left overactive horizontal canal, so the brain's, it's as if the brain's perception was that you're moving to the left more so than you are to the right. You don't want to do a right OPK because you're going to really make that problem worse. But if we made it left, that could be really good. So again, you always want to be mindful, is there a vestibular imbalance? Maybe I want to do a right brain exercise, but if that left vestibular system is ramped up, this would not be good. So, so you may have to balance that out before you work on the hemisphericity, you know, that brain-based cortical imbalance. So we can change things too, because I mentioned earlier that saliency is really important, that how interesting an image is makes a big difference in attention. And you might want to use something different. You know, we can use characters. So here we have little monsters. We have little monster set 1, 2, and then we have sports set 1 and 2. Okay, so let's say we'll start off with little monsters. And this is, again, this is more of the look OPK. This is more volitional. And when I do this, I'm going to ask my patient to look at for example, every purple one. Now the background's red. I hardly ever use a background red. You know, the color of the OPK is what actually becomes background color if you use character sets. So I'm going to change that, and I'm going to make it gray. Okay. So I can say look at every red one. Okay, so you look at the red one, and when the next one comes around, you pick up the next one. Naturally, we can make it go faster, and we can change the direction. But let's just say here we want it to go left. And we want it to go a little faster. We can increase the speed. We'll make it 3 or 4. We can even add a fixation dot, but we're not going to worry about that for now. Okay, so here we're going to go, oh, let me change the sets here. Instead of a monster set, let's just pick a sports set. Okay, so now they're going to go left, okay? This is for the left brain. This is a left brain exercise. And you can say, look at every basketball. Okay, so you're catching basketball going to the left. Okay, and this could be very, very therapeutic, especially if their optokinetic system is not working well. Maybe there's some function there, but in your bedside test, you saw that gain is not good. If you do a volitional OPK, it could help improve the stare OPK. Okay. Now, if I wanted to test for the optokinetic, a big screen like this is advantageous. You know, we did it at bedside with a smaller screen. It works. You don't want to be too far away, but it's better if you have a bigger screen. So if I were to, for example, we're going to run it down this time, and I'm going to turn off the character set, and I want those bars to be, let's make them blue, okay? Just for variety's sake. So we'll make it blue. I can set a timer. If I press timer on in seconds and minutes, if I go here and I make it, let's do a 5-second timer, okay? So after 5 seconds, it'll stop, and I can save it. If I can save all these settings, put it in a folder, and I do that with patients when they come in. I do this on their iPad. I set it all up, and I put it in a folder. I actually leave it in their home folder. I just have them use their home folder, and they're all in there. So in this case, it's going down. Oh, no, not yet. We want it to go down. Okay, there we go. Let's slow it down too a little bit. Okay, so it's going down. All right. And one benefit of making it go down here, oh, there we go. It stopped automatically after 5 seconds. When you make it go down, a downward movement gives you the impression of falling back. So you want to be careful. If that posterior system is overactive and you do this, maybe you might activate it too much. And honestly, I've seen it to be beneficial sometimes too. You know, we may do a downward optokinetic even though they're slightly overactive posteriorly, just slightly. And it gives them, because especially if it's more of a look OPK, it gives them a volitional input into this imbalance. It gives them a little bit more control over this imbalance. And I don't do that too often, but the vertical optokinetic can be very beneficial, especially if you just want to activate that frontal lobe. You know, you're going to do right frontal if it goes to the right, left frontal if it goes to the left. But if you just make it run down or up, it's just the whole frontal lobe. It's the front part of the brain that gets activated. And so it's a very good frontal activity. And I think the reason why sometimes it's beneficial is because a lot of times with this posture or this sway pattern, it could be a result of a decreased function of the frontal lobe. And we just do a downward or an upward movement and it's improved. Now, I use downward more than up, and the reason for that is because of the upward saccade. You know, you pursue down and you saccade up. And in general, the eyes become more and more comfortable as we age with looking down. And saccading up becomes harder. Now, you want to compare that against your exam findings, because that's always what you're going to do, is if you're finding that upward saccades are hypometric or they're not as fast or not as efficient, you want those bars to go down, you know, and that would be a really great exercise. Now, take everything I say, I'll say lightly, more in consideration, because I'm giving you lots of options, but it may not always be appropriate for your patient. So you want to make sure that you always compare everything to your entire exam. There is one more feature that I didn't talk about yet, and that is the center fixation dot. You know, sometimes you want to fixate on a target while the background is moving, but you want fixation. What happens with fixation is it does actually suppress the vestibular system some. So it's kind of like if you were to spin, but you know, maintain fixation versus spinning, but just keep your eyes open, but don't fixate on anything. So that fixation does help to kind of calm down the system. So you could use that therapeutically to suppress the optokinetic effect, but still activate it from a more of a peripheral perspective. Now, that's what this does, and if I were to turn that on, you'll see that in the center of the screen you'll have this dot that just stays fixed. Okay. Now, we can also do background optokinetic and maybe do something in the foreground. And where that's beneficial is especially if you've got a situation, and this is good for especially the ones that have attention deficit disorder, and maybe you want them to pursue. Maybe you're picking a target that's really interesting, but they're constantly looking at the background. You know, you do a pursuit like this, and they're getting distracted with the background. So you can't use a background that is complex. You know, you want to use something more plain, like a white or gray or something they can't attend to. But in life, you know, you may say, okay, follow this, but there's so much in the background that their eyes keep attending to other things in the background. Well, you could use a background optokinetic movement in phase with a pursuit. And if you do that, that can actually help with the pursuit motion. So what we could do, and it's better if it's not all within the screen, so that you actually have a depth change here, where maybe I'll use my thumb here and have them pursuit while the background is moving. So let's say in this case here, we'll turn off the timer. Okay, so we're going to pursue in phase like that. So you're recruiting the system, the optokinetic system with the pursuit. We have the ability to actually put in a pursuit within the screen. I think it's better to do it this way, but we have that option to have it all built in there. And this is where you go to that custom application. And in settings, we have background settings. And in here, we can pick bars, which is your OPK. And if you didn't want it to be bars, we can even do dots. It's the same thing. You're going to have dots moving in the background. And let's say we're going to move them to the right. We're going to slow them down a lot more than that. Okay. And we can change the size. We can make them big. We can make them small. And we'll make it go to the right for demonstration purposes. Actually, let's go left, because we did right last, so we'll try to keep you guys balanced. And then just disregard the quadrants. This just applies to the hemistim feature. And then in the foreground, now we have foreground options, and let's just make it the initial movement type. We'll make pursuit. The return, we could do saccade or none. We'll just do none as the return movement. And in this case, I'm going to make it go left. So for the speed, you want to try to match the speed. I think that we were... What was our speed up here? 4? Okay. Okay, here we go. So let's go to a speed of 4 in here. And you want your target to be a different color. You don't want it to be red on red. And this is set on continuous, okay. All right, let's just see how this goes. A lot of these are applied to like interval, that's for saccades. It doesn't apply to pursuit. So it'll look like this, where it'll move along with it. And then your optokinetic system is facilitating the pursuit motion, okay? And again, this is kind of like a visual following too, because when you take the entire screen and you move it in the same direction, it helps the pursuit system. So you can use all sorts of things. Sometimes, you might do the optokinetic first and then do the pursuit after, and it might be better. So, so you can use those systems together, or one before the other, to help each other. Use something that works for something that's to help restore something that doesn't. Next is our pursuit system. We talked about pursuits a lot already. And that's just it. With eye movements, they all affect one another. One can benefit the other. So it's hard to only just really separate them, because they're just meant to work together. So a pursuit motion is when you hold the image of a small moving target on the fovea. This is a pursuit motion, okay? Now, the important speed there to be mindful of is 30 degrees per second, because when you reach that, then you start generating saccades. So they're slower eye movements. Earlier on, this is something Dr. Carrick had shared that I thought was so valuable, especially when it comes to reading. When you saccade a lot, you lose vision, right? Because during the very short duration of a saccade, it's very fast. You're blinded during that quick movement. But with pursuit, a slow tracking, you're absorbing everything in your visual field. So when you read, your eyes jump, through the sentence in different spots. Some people pick every word out. Some people look every other word or every 3 word, or they'll pick out the entire sentence at one time. So the less saccades you have, the more efficient your reading is, and also the faster it is. But if you can train yourself to try to pursue through a sentence and just slowly move through, it's kind of hard to do initially, then you're going to just pick out everything that you see, and you'll be able just to keep working your way through those lines. So the pursuit system is really a great system to use to absorb more out of your visual field. And it just doesn't work in a lot of cases. It doesn't work well in cases of dyslexia, it doesn't work well in cases of ADHD, it doesn't work well with autism, and with a lot of developmental disorders, it just doesn't work well. There's a lot of people who are not diagnosed in either of those categories, but have an impaired pursuit system. So it's really important that everybody be tested, because the way that you gather information from your visual field, which is really valuable, it's our most dominant system or sense, so you want it to work well, but even when it comes to posture, the vision is secondary only to the vestibular system when it comes to maintaining good balance, good posture, and good movement. So we want that system to be as top-notch as it can be. So with pursuits, if you find intrusions in your assessment, then we want to use strategies to restore them. And those strategies are going to be similar to a lot of what we learned in the gaze stability exercise. Now, when you pursue to the right, you activate primarily that right parietal lobe and the left cerebellum. But also it's the right pons. We had a case earlier where we used, actually I think this one was left. It was a left pursuit motion, because the left pursuit motion activates the left parietal lobe, so the left cortex, and the left pons. My patient had a pons lesion on the left side. Cool thing is that not only does the eye movement to the left engage the left pons, but activating the cortex on the left, the cortex has projections that go directly down into that PMRF, that pontomedullary reticular formation. So you have that as well. So that one left pursuit exercise activates really 2 regions that can project down into that left pons. And so this can be very helpful clinically when we do pursuits on the vertical, up and down like this. Then you're activating both sides, and you're activating the mesencephalon, because that is where the muscles that move the eyes on the vertical are going to be your superior and inferior, superior rectus, inferior oblique on each side. So 2 eye muscles on each side, and then to come down, you have inferior rectus, superior oblique, those 2 eye muscles on each side. And those all have innervations that come from the midbrain, okay? The innervation of the lateral movements really come from the pons, okay? So, with an impaired pursuit movement, again, it's really hard to say for sure specifically where the problem is, because it could be in multiple areas. So it's not super specific. When you see an impaired pursuit system, you say, well, could there be a parietal lobe issue? Well, maybe, but there's a really strong possibility that there isn't, and that the problem is coming from somewhere else. And so The pursuit system and the optokinetic system and the VOR system, they use similar pathways. So we can kind of use one or the other to help supplement. If your horizontal pursuit mechanism is impaired, then using a no-no strategy where you're actually using that vestibular ocular reflex to either stabilize the eyes, or maybe you can do it in counterphase to a pursuit motion. So as I'm following the pursuit, I'm moving my head in the opposite direction. This is called the ×2 viewing. You could do that with your exercise. You need to determine if it helps the patient. If you do it at bedside and you see right away that it's helping, then you want to use that. With a right eye system, you can just test that horizontal pursuit only. It takes 30 seconds to do. You can do that strategy, put them back on the right eye, retest just that, and compare. You should see a change right away. You should see an improvement right away. If it's going to work, it doesn't take weeks and weeks and weeks to make a difference. It'll make it right away. So another important thing too is the saliency of the target can make a huge difference. Just by using a target that is brighter or that is more colorful or that is more interesting. So I'm going to go to my pursuits over here. In my settings. And here we have target type. And if I were to use random, what will happen is the target will move across, and then when it generates the next pursuit, it'll be a different target. So it's different every time. So it's more interesting. But that may not be enough. Sometimes if you use like a crosshairs, you can really focus on the center. And especially if the target is larger and your patient is scanning through the target, that can affect the smoothness. So if they're able to focus on the crosshairs, that can help improve it. Or you can upload your own image. If you could take a picture of something, I don't have any loaded in here. I don't think I do. No, nothing. Nothing interesting. But you can take a picture of the patient. What I like to do is I'll ask them, I'll try to use, with a picture, I use the biggest image, the biggest size possible. So I'll use the largest size for the target. And I'm going to ask them questions about different parts of the image. I may say, do you see the eyes? Is there anything interesting about the eyes? Do you see the tongue? Is there 1 year, 2 years, depending on the age of the patient? You say something kind of silly. Where's the third year? And they're like, third year? And then they look around, where's the third year? I don't know. But, that increases their attention. Pick a different picture for the next rep, the next set, and ask questions about what's in the picture. That's what I do with my autism cases that have very poor gaze fixation. If they can understand what I'm saying, and I'm going to do a no-no strategy, I'm going to put a big sticker on my forehead. And I'm going to draw something. And if they're responsive, I'm going to say, what do you see? Ask questions about the image that I drew. And it gives them to be really attentive as I do my no-no strategy. So the saliency makes a huge difference. But we can just use a different color. So let's just say we'll do just a random target like that. And maybe there's a color that they like better than another. Maybe a color they're more attentive to. We'll just say purple. So you can play with that, with the size of the target, the color of the target, the kind of target that you're using. Or you may want to use little monsters or sports items. And what will happen here is it'll alternate a different image each time. So there we get the yellow one. Here we have the purple one. And that can improve attention significantly. Okay? And it could be that pursuing like that will improve the pursuit mechanism. And that could be therapeutic. So also another thing we can do is gaze stability exercises. So maybe we might want to make the target hold before it starts moving. Let's just say, for example, the initial hold time will be 4 seconds. Well, we'll go to 5, get a little longer. And before we start moving, I'm going to do a no-no exercise, maybe just 1 or 2, really good quality, and then pursuit. Okay? Or maybe I could do just a quick Haumagi motion and then slowly bring my head back to center and then let it pursuit across. That might help. Maybe I'm going to do a ×2 viewing. So I'm going to move my head in the opposite direction as the target pursuits across. Maybe I'm just going to do an optokinetic before, maybe 5-10 seconds, and then do a pursuit motion, and that might make it better. Okay? So pursuits are useful to, again, ADHD where they like to saccade a lot. You can use pursuit training to kind of build that system and restore it. You can do head pursuits. So that's another option is, let's say here, I'm going to just pick a different direction. We'll go left this time. We use sports sets. And we're not going to hold initially. Okay. And here I'm going to follow with my head. So my nose is pointing at it. Okay. And maybe I might want to make it sinusoidal. Go back both sides. You know, if I have this just rough, I may have these rough intrusions or little intrusions. You see the eyes just kind of shake when they're moving. So let's make it sinusoidal. So that way I'm going to follow with a ×0 strategy all the way through that horizontal plane. And you've got a target that keeps changing. That's nice. It keeps your attention. You wonder what's the next one going to be like. And you can use little monsters. It'll rotate through 9 different ones. Okay, so that's the ×0 strategy. And ×2 would be moving your head in the opposite direction. Okay. Now, one other feature that we've added here, and we're still kind of tuning that one up a little bit, but we've got the circular movement as well. And the benefit of this, I'll cover a little bit more when we get into the maintenance exercises at the end, but we can run a pursuit clockwise or counterclockwise. And this will just engage every eye muscle. You're going to cover all of them. So it's just a great exercise to activate all the muscles. You know, is it clockwise and versus a counterclockwise more one hemisphere of the other? It's really hard to say for sure. I think it's probably more likely to be a mix. I do wonder if a clockwise motion is more of a right brain and counterclockwise left brain. I don't know. I really don't know for sure. I think that's something we need to study. I don't know if anybody knows, really. Excuse me. But in this case here, we're going to have a pursuit motion. And see, it's not perfectly smooth yet on here. We're still tweaking that one a little bit. And if it's going, if you select sinusoidal, it'll run one way and then come back the other way. Okay? If you were to take that off, then it will just keep going the same direction. So here we would have, right here, sinusoidal, take that off. And then it'll just run that way. So done. And it'll just go the same direction the whole time. Predictability helps to improve smooth pursuits as well. If you know where it's going to go next, there's a good probability that it'll be more efficient than if it's completely random. So in our cases, we use predictability a lot in these exercises. Also, attention improves the smoothness of a pursuit. We covered that already. So you want to pick things that are really useful. Now, here's something else I could share. If I had a little sticker, I've got some somewhere in the clinic, but if I had a little sticker, sometimes I have them hanging around, I could actually put the sticker, let me change this here. We're gonna do a horizontal pursuit, and I want to show you how something simple could actually make a pretty big difference in the effectiveness of the pursuit. And I don't think I've heard this anywhere else before. Maybe it has been shared and I just don't know about it. But let's just say that if I were to put a sticker on the screen, Skylar, in the back office, in my office next to the computer, there's little red stickers. If you just grab that, that'd be great. So if I were to run a pursuit straight across like this, and I put a sticker, it could be a sticky note, it could be a little round red sticker on this side, away from the direction of movement, it would slow down or impair the movement, potentially. You know, people with really great brains probably wouldn't affect them. But if I put a sticker where the target is going to, that's the first version. If it's away from where it's going to, it's a distractor. If it's where the target is going to, that's an attractor. And so you want to attract the target to that location. So here I'm pursuing, but I can see in my peripheral vision that target there, and it's going right to it. That's an attractor. If you're using an attractor, you can actually improve the efficiency of the pursuit. Okay? Just a little trick like that can make, again, a pretty big impact. You know, if you're using an iPad, you can put that on the iPad, you know, where it's going, just on the edge of the iPad like that. Okay? All right, so that covers it for pursuit. Do you have any questions on pursuits? Anything you think we may have missed? You know, in the bedside exam, there's the diagonal pursuits. And the reason for those is because, you know, when you move your eyes on a diagonal plane, it requires a tremendous amount of coordination from the brain, especially the cerebellum, because it's what allows you to move better, move faster, more efficiently. There's a lot of constant fine-tuning. We don't have, you know, it's a combination of all the, you know, of multiple muscles working together. Well, when you move the eyes on a diagonal plane like that, this is more of a left, this is for the left cerebellum here. The eyes would move in this plane. And then in the other plane, if it were the right cerebellum, we'll cover that a little bit more later. And this plane would be more of a right cerebellum. We can do that. I can't say I've really used that therapeutically. I think you could. If you want to use the pursuit system and really activate a cerebellum as well. We certainly use the combination of pursuits and saccades together to be really effective, and we'll cover that in a moment. But therapeutically, I think there's no limit to what we may need. You know, certain patients may require something that you haven't thought of until it presents itself. So you want to be open to all those. So,
yeah.
Good.
I think your emphasis of always enforcing gaze stability, if they can fixate on something first, and then they can work on pursuits.
Yep.
Since it's a movement. That's great.
Yeah. So, yeah, that gaze system, you want to use it to your advantage, especially with pursuit. You want to do everything you can to improve attention, improve gaze function, and that'll help to improve the pursuit. So, but again, you know, if you're looking at horizontal pursuit and there's, you know, I see that a lot on horizontal pursuit. Sometimes you'll see intrusions. Well, the intrusions can happen in the plane of the pursuit, or they can happen in perpendicular plane of the pursuit. If they're happening in plane, I want to know, are they mostly to the right or to the left? And if it's both right and left, I want to see, is it really to the right when I move to the right? Or is it to the left when I move to the left? Or vice versa, you know, as my eyes move to the right, is the intrusion going the other way? So you want to see what direction they're going, and that might help guide the head strategy, so that you can oppose that intrusion with your head. So if they're going down, you're going to do a down head movement to push the eyes up. If they're going to the right, you might want to do more of a left head movement, and then you can kind of match your pursuit motion too within that. Maybe you might want to make it stop, And that's the cool thing about our gaze feature in here, is that you can actually, where is it here? Gaze stability. You can actually make any motion. You can make a pursuit motion or a saccade motion, but you can make it stop in the center. So if I want to set up a left to right pursuit, but I want it to stop in the middle, you could do that. You can make it stop in the middle, do your head strategy. You may do a head strategy before it starts moving, in the middle, and then at the end possibly. So, okay, so that's it for pursuit. So now on to saccades. So saccades are, we could spend a ton of time on this, and again, our intent here is to give you clinically relevant information that you can use in a fairly short amount of time, show you how to use the app. But I would encourage you to really seek out some of the other programs offered in neurology that go deeper and more in depth into these areas, because they cover a lot more information than we have time for, and that really kind of exceeds the purpose of our workshop. But there's a lot of value in using the saccadic system, and by definition, saccades bring the image of interest rapidly on the fovea. So when you move your eyes from one place to the other, that's a rapid movement. It's a saccadic movement. When you, if we just look at these images here, when you do or perform saccades on a horizontal to the right, you're engaging the left frontal lobe, okay? That is why when you do an optokinetic to the, let's stick to the same side here. Let's go to the left. Okay, so my left, if I do an optokinetic to my left, so it would be like this normally, okay? So if I go to my left, I pursuit to the left, that's left parietal, and I saccade to the right, that's left frontal, okay? So same here, we're saccading to the left, and we're activating the left frontal lobe. We're activating the right pons, and we're activating the right cerebellum. Now, when we go to the left, it's the exact opposite. Makes sense. If we go on the vertical, so if we go upward, you're going to activate both frontal lobe, the midbrain, and both cerebellum. Okay? And same thing downwards. All right, so it's good to kind of be aware of that, because you can use that clinically. If you just want to activate both frontal lobes, you might want to do something vertical. If you want to activate one side or the other, you do more of the horizontal or diagonal. So when I say saccade to the right, whether you saccade up and to the right, down and to the right, or you saccade horizontally to the right, doesn't matter, they're all left brain. Now, the angulation can be important, because if you're going at an angle that recruits the cerebellum a little bit more, you might want to recruit the cerebellum that is hardwired to that left frontal lobe. So that would be the right cerebellum. And in that case, you might want to go up and to the right, okay? Just a little tidbit here that could be clinically irrelevant. But if you want to activate the other cerebellum, then you can go down. You're still going to activate that right cerebellum. It's just going to be a little bit of a preference based on the direction of movement with the left cerebellum. So really it would be both. So we can use saccades to stimulate the frontal lobe, because we find that with lesions of the frontal lobe, the saccadic mechanism is impaired. But volitional saccades also activate the dorsolateral prefrontal cortex. We refer to that as a kind of our executive region in that frontal area. And that's really important, because you will come across many patients who think that everything's fine, but that executive section is just not working that well. And so when the dorsolateral prefrontal cortex doesn't work efficiently, there's many exercises that we have in here that can benefit that area. So one, for example, anti-saccades will be beneficial. It's another type of saccades. We'll cover it in a little bit. Memory saccades would be very beneficial as well. And we have some other features too that can activate that. So if you just wanted to condition, your patient's dorsolateral prefrontal cortex because they have some executive capabilities that are not working too well, maybe their short-term memory is not working so well, you want to really draw blood flow and activation in that area. And that can make a really big difference for them. Saccades do that at a probably most basic level. Now, when you look at saccades, you want to consider the accuracy of the saccade, the velocity of the saccade, and the latency. So the accuracy is how good are we at hitting the target? Do we go past the target and come back? Or do we stop before the target and then catch up to it? So that's hypometria. Hyper is pass and then come back. And then sometimes they're just dysmetric and it's not necessarily more one or the other, but it's both. I mean, sometimes it's past it, before it, and it just kind of mixes between the two. With a hypometric saccade, you want to use small saccades, okay, small saccades towards the center in general. Now, you could do saccades eccentrically and still be beneficial, but in general, towards the center is even more beneficial, okay? So if I if I undershoot to the right, okay? If I do a longer saccade and I undershoot, what it'll look like at bedside is you look at the patient's eyes and they go from here to here, but you don't just see one movement, you see another movement at the end. It goes like this, boom, boom. Just a quick movement. You'll see those really well on the right eye system. And there's I use right eye, that's why I keep mentioning it, but there's, you may use another, like a VOG or something like that, and you can see that there as well. But at bedside, you'll see just a secondary movement in there. You need to shorten the saccade if that's the case. You want to make them short, and especially if they go towards the center, they tend to be much more accurate. The eccentric saccades are more likely to be hypometric. So what that would look like here, we'll use this saccade feature here, go to settings, and let's just say I was hypometric to the right. Then what I can do is we're going to start it on the left, and you see these numbers here that -4 means all the way at the end. -3 is just a little bit off the end. -2 is a little bit closer to the center, -1. So we have 4 different locations where we can start it. So let's start it, let's make it smaller. Okay, so we'll do a -1, okay? We'll make it real small. And let's make it pause for a second before it starts. And then pause for a second when at the end of the saccade. To make the saccade more efficient, I can also add an audible cue. And if you're wearing headphones that are plugged into the iPad, there's a stereo feature in place so that if you're saccading to the right, you're going to hear the sound on the right, which is slightly stronger preference to the left brain. I think it's bilateral, but there's a little bit of a preference there, so it could be beneficial. And so we're going to use, let's say, a bell sound. Okay. And the end position here, I'm going to make it 0, because 0 is right in the center of the screen. All right, so saccades towards the center are going to be more beneficial, more accurate for hypermetric. And then we'll make it 1 saccade for now, but you'll see we can make it multiple little steps towards the center. But just for now, we'll do that. Now, I've got it set on textured background. You eventually want to use textured for most of your cases, and the reason why is because it's more realistic. There's some dimension to the background. That's how real life is. There's a lot of details, a lot of depth, and so we have the textured feature here in there. And that's what it would look like. You would saccade towards the center with that audible cue. Again, that audible cue really improves the efficiency of the saccade. It can improve the speed of the saccade as well. So they're faster with that audible component. All right. Now, let's just say that I wanted to stretch that out a little bit more. We'll do that initial, initial start position. Let's make that a -3. And then I'm going to change quantity of saccades within that range. I'm going to make it 3. Okay? So we're going to make 3 small ones. We know small ones are better. Now, over time, you're going to want to stretch them. You're going to want to make those saccades bigger and bigger and bigger so that you can make a longer one accurately. Okay? And so here we go. We'll have multiple saccades working their way towards the center. And you can maybe over time start working your way out of the center and transitioning to a +1. So now we're going past the center just a little bit. And eventually you're going to make your way to 2 and 3, where you're going the same distance towards midline as you are away from midline. Okay? So then in this case, you're going all the way through from here to here. Okay, so that's what you want to work your way up to. And then eventually you can do 1 saccade across and find that it's efficient and it's accurate. Now, if I'm hypometric on a rightward saccade, would I use, we know that the cerebellum is really great at improving accuracy of movement. It's one of its main features. But when it comes to saccadic motion, it's very much involved in stopping the saccade. And if that cerebellum is overactive, it could actually stop it a little shorter, a little sooner than you would want it to stop. And so I tend to not use complex movements. So in this case, we're saccading to the right. Complex movement to the right will help activate the left frontal lobe, and it could potentially benefit a hypometric saccade, but there's a strong possibility that it could hinder it. And so I tend to wait and try to not do the complex motion. Now, if in your exam there's a lot of right cerebellar deficits and problems, it could actually end up helping. But just be mindful that it may not be the first thing that you do initially. And I've seen it work, but I've also seen it work against the patient. Now, if you've got a hypermetric saccade, then you want to stop the eyes, right? So if it's going past the target, then you could do a complex motion exercise with your arm, either a circle or a figure 8 motion. You can do that right before you do the exercise. You can do that during the exercise. Just make sure that the head doesn't move too much. If they're doing the exercise, they want to make sure they're really nice and stable. But that complex motion could be really good for hypermetric saccade. And saccades that are away from center are better. So in this case, I would start in the center. Whoop, wrong one. Start in the center right here at 0. And I would go away from center. And let's just make it 1. And now we have 1 saccade away from center. Okay? These are generally better for your hypermetric saccades, away from center. You can also do a time 0 strategy, where you could do either a pursuit or a saccade with your head and your eyes together. So it would go like this. Close your eyes, back to center, and again. Close your eyes, back to center, and again. Close your eyes, back to center. And the reason why is because here you're moving the head quickly to the right, and you're activating the VOR on the right, which pushes the eyes to the left. You've got a hypermetric saccade, you want to try to stop it, you want to try to move it in a little bit more. That could be useful. And maybe a pursuit motion could be helpful. Okay, those are all different options. If you've got general dysmetria, and this could work for hyper or hypometria, maybe it's just a mix of both. I really like the metronome feature that we've got in here, because here again you're engaging the cerebellum. That's what's allowing you to have better accuracy. And in this case, we're going to go, you know what, let's just go across from left to right. If you want to use metronome and you touch it and it doesn't work, it's probably because it's the time interval. It can't be on random, because this is a feature where we want to time a movement of a target. You're going to have an interaction. You're going to have a metronome that gives you feedback, and you want to time it. What I use almost all the time is 1 second, but I'll show you some different ways where you can really increase the time and do some really interesting things. I'm saccading to the right, so I'm going to use my right hand to really engage that right cerebellum and improve its efficiency. So I'm saccading to the right, and we've got a medium target. That's good. Let's see if that works well. Oops. I got to turn on the metronome, which I forgot to do. Metronome down here, I can turn that on, hit done, and hit start. You'll have 3 rings. Oh, one more thing we need to do. It's better to have multiple saccades, not just one, because you want to constantly reinforce that accuracy. And so in general, I like to use 5 or 6. 6 is a good number. So you want to go to target type, quantity of saccades right here. You want to make that we'll make it a 6. Or let's just say 5 for demonstration purposes. I think that'll be fine. Okay, so now you have 3 rings. These are practice rings. You want to try to hit them right on time at the same time as they move. And if you hit it on time, it'll light up green. If you're late, it'll light up in red. If you're early, it'll be yellow. I missed the early. 1 second. See, yellow if I hit it too soon. It'll be black if I don't touch it at all. Okay? So you want to try to really match that timing. Now, the first ones, they don't count towards your score. Those are just to get you in rhythm. Okay? You always have to hit this one 3 times. And it'll give you a score at the end. It'll tell you how many were right on, how many were early, and how many were late. So here's the thing with these metronome saccades. They're amazing. They're a great cerebellum exercise. Really great, especially if you put them on a diagonal. They're no good for improving the velocity of your saccades. They slow them down, if anything. But because you have a manual task where you're touching with your finger, the saccade accuracy is calibrating itself to your hand, to your finger. So where you touch, you're using that whole motor sensory system to recalibrate the accuracy of the saccade. And then there's a certain timing aspect too, where you have to match the right timing. So it's a really awesome exercise for that reason, to improve accuracy, not velocity. So if your saccades are too slow and you want to speed them up, that is not the best exercise to pick. But it's really great for building up those executive regions as well in the brain, that dorsolateral prefrontal cortex. It's really great, a really good exercise to do. The velocity of a saccade ideally is right around 500 degrees per second. That's a really good, healthy. If you use a saccadometer and you see those 500s, you can test those in the right eye system too. 500 is really good speed. Sometimes if it's really high above that, that's too fast, and you want to slow it down. And a good way to slow them down is to use a gap system, so a gap feature. So if I were to turn off this metronome, and I want a stimulus here that is overlap. I'm sorry, I said gap. You don't want to use gap. Gap speeds up. It improves the latency, the reaction time. If you want to slow them down, if you want to slow down the initiation, if you find that the saccades, like in ADHD, they initiate too quickly, they anticipate too much, and you want to inhibit that anticipation. I'm sorry, I kind of mixed that up with velocity. If you want to slow down that initiation, I use this really almost strictly with cases of ADHD, then you want to use overlap. Correct myself here, you want to use overlap. And what that looks like is when you saccade to the next target, even for a short duration, the previous target remains. Okay, it's a little bit harder to break that fixation, and so it slows down that initiation. Okay, if they're anticipating a lot too, it's really good to use a random feature. You can see that if you're doing saccades with them at bedside and they're starting before you even bring your thumb up, or before, if they're using the iPad, they're moving before the target moves. You can use the random feature here, and that takes out that anticipation. Random's all the way down, random right here. So it'll rotate through different timing at random. You never know how quickly it'll move. That's a great feature to add. I use that a lot therapeutically, unless you want to help speed them up, or you want to help with it. If they can predict when it's going to go, then their initial movement will be quicker, will be faster. So that can help if they can use anticipation on their side. Now with velocity, if you want to speed up a saccade, then you want to use the audible cue. The image brightness, the color of the image, something that they're interested in, they're going to saccade quicker to. So you can use those. Metronome, memory saccades, anti-saccades, they all slow down the speed. So if you're seeing speeds that are really high, then you want to use anti-saccades. We'll go over that in a minute. Metronome saccades are good for that too. So we just did that one. And memory saccades can be good as well. So all of that information is in your packet. I think we've covered everything we need to cover in saccades. So let's move on to the next one. So now we are going to talk about anti-saccades. As I mentioned before, anti-saccades are slower than pro-saccades. An anti-saccade is basically, it's a movement in the opposite direction of a stimulus. So if I were to use my thumbs and I went like this, naturally something moves over here, you want to look at it. Well, you have to train yourself to look in the exact opposite direction, the exact same distance mirrored to where that target is. Okay? And so this anti-saccades are considered to be, it's considered to be normal if you're, from testing purposes, if you're testing someone, to make errors. 1 out of 4, or 25% is considered normal. Now, ideal is no errors. That's where I want everybody to be, is that they don't get them wrong. And the ability to perform this task generally really develops at its fullest in adolescence. So if you've got a 5-year-old, and I had one actually this past week, where you want to do anti-saccades with, it's going to be very difficult for them, but not impossible. And I don't think we should shy away from using that exercise because it could be so powerful. In this particular case, I had a 5-year-old patient who was here for attention deficit at 5. And so I knew for sure that I was going to add that in somewhere because it's one of those exercises that's so beneficial for the ADHD population. So with this particular patient at age 5, when we would do this initially, this was a game. Okay, we made it a game. You want to make it fun. You want to make it interesting. It was a game of 10. If she got it right, she got a point. If I got it right, I got a point. And I want her to win every time. So sometimes if I've got to purposely forget to mark the ones that I get right, I do it. I want her to win. Because you want this to be exciting for them. And so what we would do is I would say, look away from the one that I move. So don't look at the one that I move, look in the opposite direction and then come back at me. And what she would do initially is she would try to move her eyes and she couldn't do it. And so she would have to move her head and then come back. Okay, she had a lot of head movement. That system is nowhere near mature yet. And the mom was asking me, is that okay? Is there something wrong? And of course the chin moves, the mouth moves, and everything goes. And she tries to get there and try to recruit everything to help the eyes. Well, in a span of 3 weeks, I saw her 3 days a week for 3 weeks. She did exercises at home. This was one of them. We did other things too. By the end, she could go straight 10 times with her head still, because I actually had her mom stabilize her head. Okay, we need to have that extra help initially. But by the end, she would always get him right 100% all the time, straight through. And it was her favorite part of coming into the office. She wanted to do this game. And what an amazing change this little girl had, doing these exercises at home, doing them in the office. I can share a story too with my son, who just went through a phase where he was just constantly touching his mouth, fingers in the mouth all the time at age 5 or 6. And it was just getting so significant that he was just constantly licking his fingers. And this is the exercise that knocked that out. And what we would do is anytime I'd catch him doing it, I'd just make him stop, pull 2 chairs, we'd sit down and we'd do this game. And he actually really loved the game. He wanted to win, And it works well for the kids that really want to win. And what we found is because he also associated that game with this constant touching of his mouth, I must have done it not even 10 times in total, and it ended it. It just has not come back. And I would just do it whenever I'd notice them, so we didn't just kind of pick it up and do it regularly. That's probably the best thing to do. So, but just so you know, that's how powerful and effective this is. So, the dorsolateral prefrontal cortex and the frontal lobes are engaged in this exercise. So this is a very great, it's one of those executive exercises. You can use it even for cases where you want to exercise those executive functions. I've used this exercise a lot on some older patients that have problem with memory. Of course, I do memory exercises, but I do volitional saccades, I do anti-saccades, and I just kind of roll through all those memory saccades, and that's just their training. They're training their brain, and it makes a big difference. And so I've had good success with that. So in our app, the Focus Builder app, you go to anti-saccades and settings. And in here, you have a lot of different options. I'm going to show you what I use the most. First of all, I like to use the red color, gray background, and I want to make sure the image is big enough so that they can see it in their peripheral vision. So going bigger is totally good and fine here. You can set the amount of repetitions. Let's just make it 10 for now. I don't know why 40 to 60 is one of those numbers that I use a lot. For people who just do this for training purposes, somewhere in that range, and I'll have them do 2 or 3 sets like that. And go no go feature, we're just going to keep it off. I'm going to tell you exactly what that's for in just a moment. But first I want to show you just the easiest version. Now left to right blanks is how many you're going to get on each side. If you want more to one side than the other, you can change that. Honestly, I never use this. For me, I keep it on 5 to 5. But you can change the ratios like that. 5 to 5 is what I use. And go, no, go off. All right, perfect. Number of dots, 2. I almost always use 2. What that means is that there's always going to be the center dot and 1 dot on the side that will appear. But the center dot will always stay. If I go to 1, that center dot disappears when the lateral dot appears. That's harder because you lose fixation and your eyes are attracted to where that target appears even more so. 3 dots, I actually never use that one. But that's the easiest one. I may find that I might need to do it. 3 dots is kind of like here. There's a target here, there's a target there. This one moves, this one doesn't. That's what it is. Whereas a target appears here, or a target appears there, but there's always that center fixation. That's 2 dots. All right, so let's start with 3 so you can see what that looks like. 2-second interval is really good for most people. We have some elite athletes. They're going to use all the way down to half a second. That is crazy fast. Crazy, crazy, crazy fast. We have a professional goaltender in Canada that does that, and what he does is he nails it. He just doesn't get him wrong, but he's really training his ability to look away and controlling his visual field, and he wants that super high speed. Oh, we're not going to do that one. 2 seconds. 2 seconds is good. 2 to 3 seconds. And in the distance, the further apart they are, it's a little bit harder to pick them out in your visual field. If they're closer, it's a little bit easier. So we'll use, we'll use 2. 2 and 3 is usually what I use most of the time. Depends on the size of your device too. And so what you got to do here is look at the center, and when a dot flashes, you want to look at the other one and then go back to center. Okay? That's what you do. Now the feature that I use the most is 2. 2 targets. So you look in the center, it appears, you go to the mirror, the true mirror location. There's nothing there. So it's a little bit harder, but you got to go to the mirror location of that target. Okay? Now if that gets too easy, then we want to make it a little harder. We can add a go, no go feature. This go, no go feature, you can use images or shapes, characters or colors. So if it's anything other than the red dot, if it's a different color, or if I'm using shapes here, then if it's something other than the red dot, you keep your eyes fixed in the middle. You don't look away. Okay? So here, my eyes would look in the center, and if it's a different shape like that, I'd stay in the center. And if it's a red circle, I look away and back to center. Look away, back to center. Look away, back to center. Okay, stay here. Away and back to center. Okay, and so on. That makes it even harder. So if this becomes too easy for your patient, then what you can do is bring it down to 1 target at a time. You can even make the time interval go faster to 1 second. But let's just keep it like that. We'll just change 1 feature at a time. We look in the center, target appears, you go away from it and back to center. Whoop, see, this was a different shape. So in that case, we want to stay in the center, even though the target disappeared. Let me just make another change before I show you that one a little bit longer. Instead of shapes, let's just make it characters. And you can load your own image. You can put a picture of yourself in there. You say, whenever the picture appears, don't look at it. And the cool thing about that is that if you put a picture of something that they really like, it makes it even harder to not look at. If they don't know what the picture is and they really like it, that's even better, because they don't know what it's going to be, and then it appears and like, oh, I wonder what that is, but you have to look away. Okay? So you can find all sorts of ways, and if you use the picture, definitely use the larger size target. So in this case, you look in the center and look away and back to center, away and back to center. Football appeared, we stay in the middle, away, back to center. Whoa, baseball, we want to stay in the middle, okay? So those are amazing executive exercises. Now, I want to share one other really great case. I've got a patient that has severe allodynia. I actually meant to share that case in our previous seminar and I didn't get around to it. I'll cover it a little bit more in depth in our next seminar this year. But basically this person, I can ask her to imagine herself walking down the street and she's going to feel the pain, just thinking about it. This person, when I first saw her, I knew right off the bat that I wouldn't be touching her. So I figured, let me use some laser. I used a laser on her. It was turned off. And I was lasering her leg while it was turned off. And seconds into it, she started screaming, ow, 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 ow. She said, stop, 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 stop. Too much, too much. And I looked at her, I said, it's not even turned on. And this was a test for me. I wanted to see what's happening in her brain. Now, not only is her ability to inhibit pain completely shot, but just a simple thought of doing things is causing pain. A lot of retraining to do here, but we're not going to do anything, especially initially, that are going to involve body movement and physical exercises. We want to build up the brain and build up the brain's ability to inhibit pain without having to use the body, okay? And so in this case, of course, I've got some great advice from another clinician on this case who said, you must make it clear to the patient we cannot talk about pain, because anytime you focus on pain, you think about it, you talk about it, you're building endurance for the pain. We want to break down that endurance, build endurance against it. Cool thing is with when you activate the cortex, when you activate the different parts of our brainstem, we activate pain inhibitory centers, that PMRF and the periaqueductal gray in the midbrain. We inhibit pain by doing these exercises. These eye movement exercises are very strong and effective exercises at building up our defenses against pain. And so that's what I would do with this patient. I go through pursuits first. I go through saccades. I go through anti-saccades, memory saccades. We do all of those things. And we would not talk about pain. And we do that day after day, week after week. And I would also start encouraging her to imagine herself doing things. And I really literally had to spend 15, 20 minutes laying out the scene for her. I'd have her close her eyes and I would say, okay, now you're walking down the street. Yes, it's painful. You can feel the pain, it's there. But you know that pain is an error signal. It's not true. It's not actually, you're not causing any harm to your body as we're doing this. And so she would have to recognize that this pain is an error signal. And when she finally got it, and I tell you, I had to do this dozens of times to get to a point where she wouldn't come in and just talk about her pain, and where she wouldn't come in and complain about pain as I'm talking her through imagining doing things. So now we're at a point where we're doing physical things. We're integrating physical exercise, and you have to start with isometrics, because an isometric exercise is an exercise where you're engaging muscles, but you're not actually moving your limb. So you can't create harm. And she understood that. And initially she could do something for a second, once or twice. Now we're doing sets of 10, and we're doing all the proximal joints and some of the distal joints, and we're doing the neck now, and doing the spine. And now we're able to do things like repositioning maneuvers and vestibular strategies, and her life is being restored. And so These anti-saccades were part of that concoction of exercises, and they're very beneficial. And I would do them on the horizontal, I would do them on the vertical plane as well. I did them in every way. I just wanted to just activate those brain centers. That covers anti-saccades, and I hope that you find that very helpful. If I just quickly scan through this, I think we covered all of it. So yeah, anti-saccades. So the next feature here, we're just working our way through our memory saccades. That is also one of those things. I love this feature. I use it a lot because it's really working that working memory, where you take a quick snapshot of something and then you manipulate that image around. We use that in our testing initially just to see if this is an area that may be a problem for the patient in the bedside exam. What I'm going to show you is the feature in the memory saccades that I use the most. Things that you should be aware about these, they do tend to slow down saccades. So if you're working on speeding up saccades, you may not want to do those just yet. You may want to put that off to a little bit later. They're great executive training, those executive regions, that dorsolateral prefrontal cortex. It's both frontal lobes because these are kind of random in different places. But this working memory, that's the key with this exercise, the working memory. And what I love the most is to use this mirror feature here. So I'm going to just start off with that. It's a little bit more advanced than if we just did non-mirror, because what you have to do is remember where targets appeared and mirror them in different locations, different quadrants. So I'm going to do upper left quadrant. Okay, so they're only going to appear in the upper left. The target type, again, just like all of our exercise, you can change the targets. It's all the same options. I'm going to use random. Okay, you can use little monsters if you want. We went over that before. We'll use random. I like to keep the center dot because that gives you a reference point in the grid of where center is. So I like to keep that on. And quantity of saccades, let's take it easy on me, and we're going to do 2. Now, they should be able to do 4 without errors. That's the goal. You want to be able to do 4. And then from there, you can challenge yourself beyond that. They're going to appear every 2 seconds. They're going to make a sound. You can take the sound off. If the sound is there, it helps to encode where they are. So you have the option. Do you want to make it easier on your patient because they're really struggling with this, or do you want to make it harder on them? And you can kind of play with these features. You can save results. If you save results, it'll save the score, and you can name it. We'll call it Mandy. And you can put a date, or you can do 2 targets or anything like that. Whatever you want to do with that. So we can save that. If I did save as, this would be to save the settings. Okay, and that goes into your home folder in the saved exercises. But this is to save the results. Okay, and I'll show you where you could see those results. So if I hit done, and there's the saved results right here at the bottom. This is where you go to see the results. But if I'm going to look at this quadrant, we've got 1 target here, and you just sit and you look at the center, you look at the first one, look at the second one, and back to center. So you shift your eyes to the first, shift your eyes to the second, and back to center. And now I'm going to shift my eyes from center up to that first target. I'm going to touch it. And you got to hit the first one first, and then back to center. Now I'm going to go to the second one and back to center. Okay? Now I'm going to have my eyes here, and I'm going to mirror this over to the right. I'm going to shift my eyes up and to the right to that first location, back to center. Eyes to the second location, back to center. I'm going to mirror this down now. I'm going to shift my eyes down here, back to center. Shift my eyes to the second location and back to center. So I always shift my gaze first and then touch. Okay? Shift my gaze down, and then the second one is here. So I got 8 out of 8. Okay? If I were to go to saved, Mandy on this day had 8 out of 8. Okay, I'm going to just delete it for now because I don't need to keep it. Okay, so that's how you do the mirror feature. You can mirror if you wanted to in the whole left hemisphere. You can pick any of the quadrants to start into. You always have to start with the listed quadrant or the listed hemifield. That's where you want to touch your targets first. So right hemifield, we're going to do them first, and then we're going to mirror to the left. Okay, you can do upper field, you can do lower field. So let's just say in this case, I wanted to do right hemifield. I've got two targets. I can make it harder by adding targets, but I can also make it harder by saying, you know what, we're going to do it in reverse order. We can even do both. We can go in order and then in reverse. But we'll just do reverse. And it's on the right side. And I'm going to start it here. So I'm looking at the center, look at the first target, back to center, look at the second target, back to center, and then I'm going to go in reverse. That was the, and if I get it wrong, it'll light up red. Okay? And then you have to mirror that over here. So here and here. Oh, that was wrong. There we go. So you have to do it in the reverse order or in order based on what you select. If you do both, you'll do in order first and then in reverse right after. Okay? Now, let's just say that I wanted to, I know that my patient has a problem. Maybe it's more of a parietal problem. Okay, the parietal lobe is activated with the lower field of vision. Okay, and the temporal lobe with the upper field of vision. So if I turn the mirror off, I'm going to go back and put that in order. And maybe I have a left parietal lesion. Then when I do my memory exercises, I may want to just use that right lower quadrant only. Right, so I turn that one off. Bottom right quadrant right here. It will only be in the bottom right. Okay, so I hit done and start. And it could also be that maybe you found that you did some mapping strategies visually. You know, you could say, okay, touch my finger in different areas, and you find that they're just not as accurate in that field, you know, that lower right field. So maybe you're going to exercise that lower right field a little bit more. Maybe you'll do a hemi-stim stimulation there as well. We'll cover that in a little bit. Can't do those at the same time. You have to do one and then the other. Okay? So you can make it harder by accelerating the appearing speed. You can take the sound off if you wanted. You could use a different sound. That was a water droplet. No sound. Okay, so you got all these features. So again, this is just one of those exercises that is so incredibly beneficial for that dorsolateral prefrontal cortex. I have all my patients that have challenges with memory do this exercise and use this feature. And others that just want to, you know, this is great too for ADHD because you want to exercise that dorsolateral prefrontal region, and it does that. So this covers our memory saccades. The next feature is random saccades. You'll see a random saccade icon over here. This feature is good if you just want to just light up the frontal lobe. You can't predict where they're going to appear. These are totally random. They can appear in different locations, and the patient is just looking at the last appearing target. And so this could be very useful, especially if you've got some patients that have a decline in frontal function. It's random. If you find that they're anticipating too much and you want to anticipate less, obviously you can't anticipate those. So it's also, again, this is a good dorsolateral prefrontal cortex stimulation, maybe not to the level of your memory saccade and anti-saccades and metronome saccades, but still it's activating that region. And you can decide which quadrant you want them to be in. again, you may want to remap a particular quadrant more than another, and whatever you want to do, you can do by selecting where they're going to be. Now, I'm going to just make sure that they're all on, and the quantity can go up to 16. This is one of those areas in the app where we haven't been putting as much energy into or resources into, but we have some tremendous ideas of how we want to evolve this feature in the future. So we've got more to come here. But for now, let's control here appearing speed. We can make it like every 0.5 seconds, 0.75 seconds. And we can add a sound or no sound, just like everything else. If we add a sound, it'll kind of speed up the saccade. The velocity will be higher. And we can do target type. I like to use sports sets or monster set or random. Actually, random's a good one on this one because you want to make it even more random, right? That's the whole point. And so you want to look straight ahead, look at the target, and keep catching the next ones. So there's two different ways you can do this. You can either saccade from target to target, or you can have them return to center and then saccade eccentrically. I kind of like that a lot, but you can't do it if it's too fast. I mean, unless they're able to saccade really fast. So I might want to slow this one down a little bit, and then they could do that. They can go to center and then go eccentrically each time. I've done this too where naturally this doesn't give you any feedback, but let's just say that I wanted to improve the mapping, the awareness of, let's say, upper right quadrant. And I may ask the patient to touch as well. Now, the touch feature in here does not give you feedback. It's something that's going to come down the road. But even if you didn't have that, you can have that touch feature where you have them touch the target each time. And maybe you might want to touch the center to make sure they return to center, you know. But that's also with shifting your gaze to it. We have a different peripheral vision exercise that's going to come that I'm going to show you in a little bit, where you don't shift your gaze. In this case you do, because you want to saccade to it. You can do a manual saccade, or you can just do an eye saccade. And you can keep them within a single quadrant. Okay? So that's pretty much it for the random saccades. You can find all sorts of ways to do that. Now naturally, if it's going to the right, you're going to have more of a left frontal lobe activation. If it's going randomly through the screen, it'll be both sides. So the next feature is the combination saccades and pursuits. And that is such a tremendous exercise. It's really to the credit of Dr. Carrick. These are known as the Carrick brain exercise or brain eye movement exercises, where you have a pursuit movement within a saccade, or a saccade movement within a pursuit. And they're both following the same plane of movement, but in opposite directions. So the benefit here is that you can completely isolate one hemisphere of the brain. So if I were to do, especially on a diagonal, but you can do that on the horizontal as well, but on the diagonal, if I saccade up and to the right, okay, saccade up and to the right, and then I pursue back down and to the left, the muscles that I use in the eyes to go saccade up and to the right are your superior rectus of the right eye, inferior oblique of the left eye. Those are both innervated by the mesencephalon on the left side. And the superior oblique and the inferior rectus of, superior oblique of the right eye, inferior rectus of the left eye, when you pursue back down. Again, the innervation of those muscles is the left mesencephalon. So this motion is a pure left mesencephalon motion. Beyond that, it's a cerebellum, right cerebellum, left mesencephalon, left cortex. These are hardwired together. They're meant to work together. They're connected at birth. So they're hardwired. And this movement of the eyes in that plane, in this pattern of saccading up and pursuing down, is just a beautiful strategy that activates one half of the brain. And we can use that therapeutically significantly, you know. So if you find that there is a hemisphericity, this is a great hemispheric exercise. So if you were to do that on the horizontal, then you would engage the pons a little bit more. So it's just a little bit less pure, but that's okay. That might be appropriate. And this is for the right brain. So in this case, you would go in the opposite direction. This is a great cerebellum exercise as well. A great advantage of combining the saccades and the pursuit is not only that you can return to your starting point and keep going, and in every movement you're always activating the same part, same region or same section of the brain, but it's a very effective strategy to improve visual mapping, so the visual maps. And those maps really reside in the colliculus, the superior colliculus. This is a great collicular exercise, or those maps are called collicular maps or visual maps. So it's a tremendous exercise for that. So we can use it to stimulate the frontal lobe and the parietal lobe on the same hemisphere, single hemisphere, unilateral midbrain, unilateral cerebellum. We can do all those things. Okay? So let me show you how this looks like on here. So it's this application up here, combination saccades and pursuits. And this is a great strategy also because you're combining a horizontal vector and a vertical vector together. And so when you have a diagonal movement, it's a combination of both horizontal and vertical. So it's really ideal for improving visual awareness or visual mapping. So the settings that you'll find here are similar settings that we saw earlier with the pursuits and the saccades. And all these settings are on here. You can change the direction. We can make it in diagonal motion. Again, this is certainly a feature that I use a whole lot. Target type, let's make it random. You know what? Let's just pick something else. The crosshairs is a really good one because it allows you to really fixate on the center of the target and have less visual scanning. Background, let's make that background textured. It's just more realistic. Time interval. If we make the time interval random, that can really help to prevent anticipation. If a patient is struggling making their saccades, especially the initiation of a saccade, then you might want to not use random because you want them to anticipate and use that in your favor to promote that movement. But let's just keep it on, let's make it 1 second. Okay, let's just say that we want to use anticipation on our side. Okay, we want to help the patient make better saccades. And this is the reps of how many times we're going to go through the sequence. Well, so let's just do it twice. And the quantity of saccades, let's make it 6. So from the bottom to the top, we're going to have 6. The initial pause is 1 second. Final pause, 1 second. Start positions -4, so that's at the bottom of the screen. Let's just go to 3, which will be not quite at the end, and let's make it -3. This is a big screen, so I tend to use those features more when I'm not using the iPad. Express. I use Express or Gap almost exclusively because you want to facilitate the initiation. And when we train, we want it to be quicker, easier, so we want to build that up. If their initiation is too fast, if they've got ADHD, then you can use the gap, but I rarely use it. And then initial type of movement, I like to start with saccades, so we're going to do saccades first, and then pursuit. But you can do it the other way around. You can switch it around. Pursuit speed is at 4. That's a good speed. Let's add the sound, because we want to really help our patient have faster saccades, faster initiation, faster movement, more velocity, better latency. And so we're going to help them a lot. Okay, and then we hit start. And with our eyes, so you want to make sure that from a posture standpoint, that your posture is as good as it can be. You want to use this visual encoding to also benefit posture. So sit straight, have your head in the center of the screen, your eyes level at the center of the screen, so you're really stretching your gaze. And you may need to start shorter and work your way, to a larger spread. You can make those clinical decisions based on your patient. Okay, so we did it twice there and it stopped. This is a great time to use the metronome feature. And I have a patient that does this every time he comes in. He doesn't own an iPad, so he doesn't do it at home. He only comes in once a week. And he had a tremor in his right hand. He had a hard time holding a cup or pouring out a glass. And so this is the exercise that he does every single week. He comes in, he does exactly this exercise, and it just took care of the tremor. It's gone. He only does it once a week. Now, we tend to recommend to do things multiple times a day to really build endurance and help create a change in the system. And I suspect his tremor was more of a cerebellar tremor, but he has done just remarkably well. So what we do is we turn the metronome on, and what I like to do, okay, we've got a 1 second hold, okay. So he's gonna do his metronome exercise here all the way through like that. But I like to do a circular movement. Perfect. Now he would pursue it back down, but I like to do a circular movement through it. If you want to space out the time, in here, so that maybe you do a full 8 and then touch, you could do that. You can space it out so that you can do 1 or 2 figure 8s and then touch. You can get really creative with this, but that way you're really adding layers of difficulty within your metronome exercise. If I wanted to, I could run it vertically, and if I want to alternate each hand as I'm going up, I could do that too. So there's a lot of different ways you can play with this if you want to do a bilateral stimulation or just a unilateral one, but you can get creative with that. So again, these are great to improve those vectors. Earlier, when we did the bedside exam, we tested diagonal saccades. And that's to see if when you move in diagonal, if the eye has a preference. So if the eye moves horizontally before it moves vertically, instead of going straight from here to here, the eye does this, horizontal then up. That initial movement, if it's vertical and then over, or horizontal and then over. What it does is it shows you which direction, which vector is more efficient. If you move horizontal and then up, that means that the horizontal one is more efficient and the vertical vector is not as efficient. So you might want to do vertical saccades first, really work that up. You might need to do a yes motion each time, to really push that vertical drive there using the vestibular ocular reflex. So you make it hold long enough so that you can do a yes motion and then up and then a yes motion. Okay, now so you can use that as well. Okay? And that covers our combination saccades and pursuits. All right, so peripheral vision is our next, and this is one of our latest exercises. This was just added, honestly, today. So if you're getting this, by the time you get this, you'll have it in your app, but this is really brand new. I've been playing around with it a little bit, but we're still within beta test flight version here. Cool exercise. So here's the thing with the peripheral system is that it's the majority of our visual field. And up until now, we haven't really done anything as far as our application here with the peripheral system. And so we want to train it. And it's a great addition. So we just talked about visual maps, using combination saccades and pursuits to improve it. Well, you can also use a manual task in your periphery to improve that visual map as well. And this is what this exercise is about. It's also a very good dorsolateral prefrontal cortex exercise. Sounds like a lot of these are, because there's a lot of volitional control. And in this case, we're going to have central fixation. We're going to look at the center target, and we're not letting the eyes drift away from that center the whole time. So there's an image, a shape that's going to be in the middle, and you want to find that matching shape in the periphery, and you have to make contact with that matching shape in the periphery without breaking fixation. Okay, so you're using the peripheral system to do that. All right, so we have the option, oh, here it is. We have the option to isolate a specific quadrant or to have a motion. So let's start with the motion. What motion means is that the peripheral targets are going to move either clockwise or counterclockwise around the center target. So if I move them clockwise, and let's say in this case we get two, okay, level is right here. So if you want, you have 5 levels. Level 5 has the most amount of targets. Level 1 has the least amount of targets. Okay, so I'm going to run it clockwise, and I'm going to hit start. My instructions to the patient is to look right here, and with the peripheral vision, touch the matching shape, okay? So if I were to look at it like this, I want to make sure that I don't break fixation. Now, what you can do clinically is you want to look at their eyes to make sure that you look for movements. You want to make sure their eyes are staying fixed and still. Because if you see any drifts, any movement off plane, then that's something that you want to be aware of, because as they're progressing, you want to see less and less of them. So you might even want to count them and make note of them. And that's if you can, be attentive while they're doing this exercise. That might be the way that you test their ability to do this exercise, is to see how accurate they are, and also to see if there's any visual drifts, any saccadic drifts here. And so you'll see that by the time we finish, this runs for about a minute, okay? And I got 13 correct. I made 1 error, so at some point I missed the target. My average reaction time is 4.4 seconds, which is terrible. It should be a lot faster. I was busy double, triple tasking here. But this is a great exercise. We focus so much on restoring that central 5 to 8 degrees of central vision, which is really super important, and that's why we put so much emphasis on it. But we have to reconnect with our peripheral system too. So I like this exercise. I think it's a really great one to add in to kind of tune that peripheral system. And you can do maybe a combination of this with other more centrally based exercises. So there's other features in here. Naturally, you can make it go counterclockwise if you wanted to, clockwise, counterclockwise, or we can turn off the motion. And let's just say that I wanted, we'll do upper right here. Let's say I wanted the targets to just appear in the upper right quadrant. And we could do 1 target, which would be really easy. but we can go all the way up to 16 targets, which is the hardest. And with 16, I'm looking in the center here, and I've got to touch the correct one. If I'm not perfectly accurate, I have to do it again, and then again. And then at the end, it gives you your accuracy score, and it gives you the reaction time score. And those are good to note because over time, you want your patient to improve. So you can make note of what those scores are, and you want them to, inch forward, constantly progress forward and improve. So if I did multiple quadrants, what you would have to do, let's say, we'll just do the right field. Let's just say in this case, we've got a hemisphericity. The left hemisphere is just not efficient. Everything we're doing is aimed at that left hemisphere. Or if I had more specifically a left temporal lesion, then we want to activate the right upper quadrant. If it's a left parietal, it'd be the lower quadrant on the right. But if it's the left hemisphere, it's going to be the entire right hemisphere. So I'm going to do right quadrant and right quadrant. And okay, we'll leave it at 16. And in this case, actually, one important thing to know is this number is a number per quadrant. So there would actually be 32 if I leave it on 16. So that's a lot. So if I bring it down to 8, for example, now I'm going to have that center target, I'm going to have it in the upper quadrant and I'm going to have it in the lower quadrant. I've got to touch both, okay? So here we go. I'm going to hit training. I've got a star, and I've got a star here, and then I've got a star here, and done. So you have to touch them both in order for the screen to move on to the next one, okay? So you get one per quadrant. And one thing I'm working on is to give us maybe a light up green, that might light up to show that we've touched it accurately. But that's something we're going to have to add very soon. Okay, so that gives you, I think, a pretty good overview of what this peripheral exercise is. Again, for those executive deficiencies, you can throw in a series of these exercises that are good for the executive center, and this is a great one to add in as well. All right, the next exercise is called visual memory. So there's a lot of benefit to this one. This is definitely a short-term memory exercise because you're going to get shapes or letters or a series of words that will flash before your eyes. You got to remember what they are, what that sequence is, and you got to find it amongst an option of 4. So it's a short-term memory exercise, but it's more than that because the progression really should be to go from shapes to phrases. Shapes are easier, letters are a little bit harder, phrases are the hardest. And so obviously the younger the patient or the more challenged they are, you want to start with shapes and progress your way through. There's a testing mode, so we're in test mode right now, and there's a training mode. The test mode will give you a level, the level at which you're testing at. And it gives you a starting point for your training. Well, the reason why I love this exercise is because when you especially train with phrases, you'll have a string of words and you have to quickly see that. So it's a great training exercise to quickly pick up a string of words and remember what they are and then identify them in an option of, multiple option of 4. And so this is great for reading. For the readers that are slower to read, it's a great way to just train them to just not saccade everywhere, but just use your entire visual system, look in the center and just take a quick snapshot of what you saw and then identify it. So let's train with shapes first. So that target appears. If it's correct, you get that beeping sound. If it's incorrect, you get this different kind of sound. And then we're going to go through like that. It's going to progressively get a little harder. And then, if I start making errors here, it might actually stop me and just to level 10. Okay, so I scored a level 10. So if I go over here under done, and I got to go to settings first and pick my level. You have 10 levels. So I did really well with shapes. I think I made an error or so. But most likely, if I'm at level 10, I might want to move to letters. But in this case here, shapes, level 10, and then I would hit done, and I would go to training, and I would be training at the level 10 level. So you see that I'll go through and I'll pick random ones, and it's going to give me a score at the end. So I got 70% correct. So you're going to have to determine for yourself what percentage do you want your patients to achieve in order to progress to the next level. You could retest them certainly and then get that to tell you where they're at. But ideally, you want to get them all right. You want to get 100%. I think 90% is acceptable, but you should be getting them all right. Now, it gets a lot harder. So if I go to test and I test with letters, then you're going to see a series of letters. Okay, these stayed in the middle. It's a little bit easier. So get that one wrong. So progressively, there's more and more letters. I wasn't paying attention there. Okay, so level 10, and level 10 because I really got at least 80%. I think I missed 2. So I tested at level 10. So I really should be doing phrases, okay? So if I were to do phrases, it starts with words. This is just testing, so it's going to progressively get harder as we move along. Level 3. So there you go. So then what I would do is I would go to settings and go down to level 3. 3. And then I would select phrases. But you know what? And you saw what level 3 was. So let me just show you how difficult it can get. Training at level 10 is really, I want phrases, not letters. So you can see how quick it goes and how similar some of the phrases are. And so you have to be able to just quickly grab it and pick it up. So it's a really tremendous exercise. I think that's really valuable. And so that pretty much covers it for visual memory. Next, we're going to do vergence. And you'll see that I'm not going to use this big screen because we need to actually use the iPad in this position. We have a test and a training, okay? So if we start with test, the test is going to actually, I'll get it started so you can see it, but basically on the patient side, I'm going to line this up at the level of his nose like this. But just so you can see it, my questions to him are right here. And what I want to know is, as the red dot is what he's focused on. I want to know if he can see it clearly. And the first question is the red dot clear? Yes or no? Where do the lines cross? So see this line right here? When you have this right here at this level, okay, when that line is straight ahead and it's right at the tip of his nose, he should see two lines cross like an X, and it should cross right in the middle of that red dot. If you look at the center of the red dot, do you see the lines crossing?
Yeah.
They cross before it, right on it, or after it?
On it.
On it. Okay, on it. So if it's, yes, the dot's clear. Was it clear?
Yeah.
And they cross on it, then you keep it on yes, and you don't change anything. All you do is press next. And then you see that the dot moves closer. Now, normally I would be standing so that I'm a little bit higher, or I might even have this on my tripod so that it's very steady, okay? But in this case, again, now it moved closer, and I'm gonna say, okay, is the dot clear?
Yeah.
And are the lines crossing on it, before it, or after it?
After it.
After it, okay. So he said after. So what I'm gonna do is I'm gonna select after, and I'm gonna press next. And the test stops me right there because we have a positive finding. And it's a convergence, we're gonna do a convergence exercise at level 2. So if you're looking at a target and your eyes are crossing, they're meeting, the actual axis of gaze of each eye is meeting behind the target. So these lines are crossing after it. That is a convergence insufficiency. Okay, so your ability to converge is not as good as it should be. So now I'm gonna select settings, and I'm gonna go to level 2. So we're gonna bring that to convergence. I'm sorry. So levels at the top. So convergence. It says divergence here. So he does not have a divergence issue. He has a convergence problem. So we're going to do a convergence exercise, and we're going to bring it down to level 2. And the direction, what you can do in divergence is you'll have the option to pick which direction you want to diverge to. We'll cross that bridge in a minute. Okay, so for now that's all you can do for convergence. And what the training will be is the target will appear here, and it'll start moving. It'll do 2 saccades towards him, and then it's going to hold there for a good 5 seconds, and then it's going to come back down. Actually 3 seconds I think is the whole time, but it'll repeat that 3 times. So it's training you up to the point of difficulty. Okay, so you start a little bit further and you're saccading twice to that point of difficulty to exercise and strengthen your ability to maintain convergence there. Okay? So you can repeat that multiple times, but it'll do 3 reps automatically. All right? Now, let's just say that we did this, and instead of having crossing the lines after it, they cross before it. So is the target clear? Maybe not. So let's say yes, we'll keep it, we'll say no. But let's say the lines cross before it. We select before, and then we do next. And then what you'd have is divergence level 4. Okay? So what you do is you go to the training. Oops, I'm sorry. We've got to change our settings. Settings, and I'm going to do level 4, divergence. With divergence, you have 2 other features that you can use. One is the direction of divergence training. So target's going to come near you, and then it's going to quickly diverge out or move out, and your eyes are going to diverge as they move, follow the target away. You can make it move out in the center, and then alternate center, right, center, left, center, right, alternate like that. Or you can just make it go out to the right every time, or go out to the left every time, or go out to the center every time. It's up to you. Now, the reason why you might want to pick one over another is that if you've got an esotropia and you've got that right eye is just so dominant, maybe there's a convergence, an excessive convergence here, or a convergence dominance that's too strong. But if you get one eye that's stronger than the other in that convergence motion or that ESO deviation, you're going to want to break that convergence by moving out on the side of that dominant ESO deviation. Okay, that makes sense. So if the right eye deviates in too much, then I would say, okay, we're going to do a right divergence, okay? And the number of reps here, we'll do 3 reps, okay? So if I hit training, okay, this is what it's going to look like. And this would be up like that in front of him, but so he would be following the target in, and then it's going to go off to the right, and then it's going to come back to center and come in again, okay? So basically it would be like this. He's pursuing it in, and then he's saccading out. And this would be up to his nose, right at the tip of the nose. Okay, so again, it would be pursuing in the center. This is the point, this is exactly the point of difficulty where you have the excessive convergence and it's coming back out, all right? And this would be helping to train that eye that's got the greater ESO deviation. If you selected all direction, it would rotate through each one every time. Center, right, center, left, and alternate like that, okay? So the vergence feature is just one of those things that, again, we haven't done before. This is a new one, and it's a very valuable one. I think you'll like adding this to your testing aspect. So you get a new diagnostic tool now, but also a new training tool. And it's very important because our ability to converge, I mentioned it earlier, it can even affect balance, especially that A to P sway pattern. So you'll be able to detect exactly if it's a convergence or a divergence problem, and also train it and repair it. But you can use it therapeutically if you want to as well. So I hope this is very useful to you, and that it really brings you more tools to your tool bag. Okay, so HemiStim is another great feature that we've got in our app. You'll find the HemiStim feature in the HemiStim application, but also in the custom version. And in the custom, you can have a specific HemiStim in the background and a moving target in the foreground. And that's really useful, especially if you want to do for example, a left brain strategy, where you've got a saccade going up and to the right and pursuing back down with HemiStim, so these flashing checkers in the background on the right side. So that would be a great left hemisphere exercise. So you're kind of beefing up your eye movement strategy to further stimulate regions of the brain that you want. Now the cool thing about the HemiStim is it's a visual stimulation. If you wanted to just have a cortical effect with little to no brainstem activation, this is the one that you want to do, okay? Because in this case, it's not so much an eye movement strategy, it's more of a visual stimulation. So if I went in here, and a lot of these, by the way, they're in our presets. If you look at presets for HemiStim, we've got some presets in there. Let me just take you through how to change the settings, and then I'll show you some examples of a good left brain, right brain, or left parietal, right parietal. If you want to isolate a specific parietal or temporal lobe. The thing is, the parietal lobe perceives vision in the lower field of view. Left parietal, right lower field, right parietal, left lower field. The temporal lobe is the upper field of view. Left temporal, right upper, right temporal, left upper. Okay, so we're going to use that. Now left hemisphere, right hemifield. Right hemisphere, left hemifield. If I wanted to just do bilateral parietal, I would do the lower hemifield. Bilateral temporal, upper hemifield. And that's how it goes. Now, there in your packet, you'll have a sheet like this, okay? It's a really good guide to have because this guide, it tells you everything you need to know to create either a left hemispheric or a right hemispheric strategy, how to set the settings, or a left parietal or a parietal versus a temporal strategy, okay? So let's just do a left. We'll do a left hemispheric strategy here. So From a color standpoint, we want to be more so on the red, orange, yellow end of the spectrum for the left. So if we go to color, I'm going to do red. But we get also be mindful that from a contrast standpoint, for the left brain responds better to higher contrast. Okay? So if I do red and orange, it's not a big difference, right? So it's a smaller contrast. But if I do red to white, that's a really big contrast. So I'm going to do red for color number 1. Oh, it's already on white. Okay, and white for number 2. Okay? So, so I've got red, I've got white. Let's do size. Okay, so left brain is more into details, smaller. So we want to pick the smallest size. Go all the way down. And speed, the frequency is lower. So in this case, for speed, we're going to, if you go below 10 on this, they're ultra slow. Okay, so for lower speed, I like to use right around, I think 12 is a good number. Faster speed, I'll go 13, 14, 15. So 10 to 12, I think, is good for lower speed. And then in this case, we're going to do, it's for the left brain. So upper right, and we're going to do bottom right. Okay, this is going to be the whole right hemisphere. We have a timer feature here if you want to set a specific amount of time that you want this to be on. Let's just, for demonstration purposes, I think we did this earlier with a different exercise, but let's make it 10 seconds. Okay, so after 10, it'll just stop. And you can also add a center fixation dot if you want. And what this would do is it would make you focus on the center, and that could be helpful too. So, and that's what that would look like. So you'll see that the red and alternating red and white is not as fast as it could be, and that's purposefully so we activate more so the left hemisphere of the brain. So now, if we wanted to do more of a right hemisphere, we could change the settings here. You could also go to saved exercises, and I believe we've got one in there. Hemistim left brain, hemistim right brain. So let's just press start here. And let's just double check those settings. So we get blue and indigo, okay? So those are closer together, you know, there's less contrast. The size is set as large, but yeah, we want it large, that's right. We want, the right brain is more big picture, larger. Speed is at 15, we want it fast. Quadrants are set, center fixation dots on, perfect. So if we hit start, that's what that would look like. That's a good right brain exercise, and all these are written in here. If you want to stop an exercise midway, you swipe up like that and you hit done. All right. You might need that feature, and you might need to teach your patients that feature, especially when you do that memory exercise, because a lot of times they can't find where it was, and they go and they press all the quadrants and in the grid, and they can never find it. Like, they give up, and so they need to know to swipe up and restart from scratch. Okay, so that's for the left. Now, if we went to let's see if we've got a left parietal, or maybe we've got, yeah, let me see, hemistim, right brain, hemistim. Okay, we don't have it in there. That's okay. We'll go ahead and create it. So if I wanted to do, for example, in here it says, if you want to do a hemistim for the parietal lobe, you'll find that the settings for the parietal lobe are very similar to the settings for the right brain. They're almost identical. It gets a little bit trickier if you have a left parietal, for example. So this is, so the right brain and the parietal lobe very similar. If you have left parietal, well, you do the parietal settings and you position it on the right so that it's left. But just know that from a hemispheric standpoint, it may not line up perfectly. And that's okay, because your goal is strictly the parietal lobe, and that's totally fine. So in these settings here, the last thing we did was right. So this is good. So these settings are similar. So we're going to keep everything the same, but we're going to change the field of view here. We're going to do lower field, not upper. So we're going to take out the upper. So we're going to hit done and start. Okay, so this is good for a right parietal lobe. Okay, if I want to do left, I would just switch that over to this side. Okay, now if I change those settings and we went back and we wanted to do a temporal lobe stimulation. So the temporal lobe is very similar to the left brain settings. So actually, just to make it a little quicker, I'm going to go in here, and you might want to save these settings in there, but I'm going to go ahead and pick out my left brain settings, and I'm going to go to settings here, and the speed is a little bit lower. Smallest, it's red and white. Okay, so we want to have a, let's see, temporal lobe is a lower contrast. So we're going to make it red and yellow. Okay. We need the smallest. We need a speed that is lower, so we're going to go down to 12. And we're going to want, this is temporal. Let's just say in this case it's going to be a left temporal lobe. Okay, so we want the bottom right quadrant to be on. Oh, thank you, Skylar. Upper quadrant. Upper right quadrant. Okay, and here we go. So this would be a good left temporal lobe stimulation. All right. Now, I mentioned earlier, you know, if you wanted to have a movement in there as well, you could go to. You can perform these exercises here in the custom. And in the background, I would simply select HemiStim. And I'm going to go down here. Let's say that in this case, I want it to be a left hemispheric stimulation. So I want the right quadrants to be on. Okay, those quadrants are going to be on. I'm going to turn off the timer. Okay, and then in the foreground, express is good. Okay, I'm going to do, I want to have a saccade up and to the right that pursuits back down. This is just a great left hemisphere exercise. So start position is good, so let's make it go this way. I'm going to go up that way. And then initial movement, we'll make that a saccade. And then returning movement will be a pursuit. I picked a crosshair here, color blue. Let's make it a different color. Let's just make it green. But, you know, in this case, I could do a red or something like that. Green is right in the middle. It's pretty neutral. And then, okay, size. We're going to go, so with the left hemisphere, we can go smaller. You know, the left hemisphere likes detail. The crosshair is good. You know, we want to focus on the center. And then quantity of saccades. Let's make it 5. Pursuit speeds is 4. It's on continuous, that's fine for now. Initial pause, I like to give it at least 1 or 2 seconds before it starts moving. And same thing with the return. Time interval, we're going to make it random. And we're going to give it to sound. So we want to really improve our latency. We want to, let's see, use the sound, the bell sound for the velocity. Actually, if we wanted to improve our latency, we could take away the randomness, so that way you can anticipate better. Now, if that wasn't an issue and you want to make it harder, then you can use random. But there we go. So here we go. That should be good. Let's see if that works. So one thing that needs to change, the left hemisphere does better with detail. So I need those squares to be smaller. So it's on large, we need to make it at the smallest. Okay, that should be better. And so then you would track the saccades up and pursuit back down. That's a pretty fast pursuit. I might want to slow that one down a little bit. But that gives you a really robust left brain exercise. I mean, you've got pursuits that are good for the left brain. You've got saccades that are good for the left brain. You're doing a diagonal movement, so you're engaging that right cerebellum, which projects right into the left cortex. And then on the background, you've got a hemistim stimulation that is appropriate for the left hemisphere. That is a very good exercise. Now, it may be too much for a lot of people, so you've got to consider that too. But as they progress, you want to just keep reinforcing and beefing up their exercises. I had a patient recently who was seeing me for a concussion, and I knew I had my diagnosis right on. I had picked out some good exercises for her that were appropriate based on the findings. And she was getting better and better and better and better. And then right at the end, she's like, I'm feeling so much better, but it's not gone. I'm still getting headaches once in a while. They're light, but they're still there. So she plateaued. And we had to really enhance the exercise plan where we couldn't just do saccades and pursuits anymore. We had to do metronome. And then I used the Metro Timer app because she had a left midbrain lesion. So initially we want to just gently activate it, but at this point we had to really push it and challenge it. So now we had to add in the metronome feature with the saccades. And then beyond that, I would get the Metro Timer app, and where you have a metronome and a light at the same time, and I would do that from the right side. And I was trying to also time a complex movement with her right arm on beat with the metronome and the light all at the same time. And then we progressed to doing arm and leg movements in counter phase with the metronome and the light at the same time. I mean, we really ramped this up. And that's what finally took care of the problem. And so you just got to be mindful that people get better, and at some point they just need something that's stronger, and they need to be stimulated at a much deeper level. Okay, so the last thing I want to cover is that, once your patients reach a point where, they've repaired what was broken, but now they want to keep conditioning and challenging their brain, there's a series of exercises that you can give them. You can create that for them. I've created a sequence myself that I want to share with you. This is something that they can do every day. Like, these are your everyday brain-eye exercises for maintenance. And what I'm hoping actually is in a future update, we'll try to get that saved and done in there. But you can put it together, create a folder yourself, and call it maintenance. And actually, you know what? I'm going to show you exactly how to do that so we can do it together. But first thing is, I went into the presets folder, and there's an exercise here called gaze stability. And I'm going to actually use the settings that are already done here because it takes a long time to get those all set. So they're already done. And I'm going to just do save as. And now this will be saved in my home folder. So if I go back to home, it's right here. And it's still in my presets also. So I can make changes to this, and it's not going to change the presets. In this case, this exercise is set such that you have enough time to do a yes motion and a no motion, and then it moves. It's going to move in the exact same position of basically 5 of those dots. A center dot, 1 to the right, center to the left, center, bottom, center, and top. Okay? And in this case here, I think it's even set to saccade. It's doing 2 saccades back to center. And what you could do with that is at each time the dot stops, it gives you enough time to do 1 yes motion and 1 no motion every time it stops. It'll go all the way through the horizontal plane and the vertical plane. So it'll go center, midway over, midway, center. It'll do that up and down, okay? So this is a really great exercise because it allows your patients to exercise their gaze stability functions, which is beneficial for so many parts of our brain and even our posture and our body. So it'll run through all that. I would do that as the number 1 within the sequence, okay? And then we could add in vergence, okay? Some kind of vergence exercise. Now, I'm going to do it here just to show you, but naturally you know that these versions feature, they are best on the iPad, not on the big screen, because I'm not going to take the screen and bring it here. But in the settings, you know, and you may determine that for your patients, if they had worked on convergence versus divergence, that's really where most of the people are. More people need to train their convergence. And you set the settings, and then you save as, and then you can name it convergence, and then save. And it's got to say saved in green in order to make sure it's saved. Okay, so that's done. So now in your home folder, you've got those two. And you can create a new folder called maintenance and just move those out of there and put them in there. Now the next one would be the circular pursuits. And I would do it 2 ways. Let's go to pursuits. The neat thing about these, you could do it 2 ways. If you wanted it to work your convergence with the circular motion, and this is how we do it. So first, we're going to do a clockwise one. And let's just say that we're going to do speed 2 and repetitions. You know, we'll do, actually 3 is fine. We'll do 3 reps. Okay, so we'll make that dot a little bit smaller. Medium is a good size. Okay, so it'll move in a circle like that 3 times, okay? So that way we're exercising every muscle of the eye. And we can also then run it, you know, we can save that one and then run a new one counterclockwise, so we can go both directions. What might even be easier, actually, is just to save it as a sinusoidal. And that way it'll run both all in one exercise. So we'll go all the way around, come up, and then go back around the other way. Okay? So that would be a great way to do it. And then what I would suggest you do, we're going to use the iPad. We're going to go in pursuits again. I'm going to set the settings in a similar way. And I'm going to make it go sinusoidal. So it's on. Okay. And I'm going to actually put the iPad like this. So as I'm looking at the target, it's moving away and then coming back down. So it's getting me to do this exercise also as a convergence and divergence. So you're diverging and then you're converging. You're diverging and you're converging. So it's good to exercise your eyes in different planes in different ways. And then, so we had our gaze exercise, we had our vergence exercise, we covered all the muscles of the eye by doing the circular pursuits. And then we can do a combination, saccades and pursuit. This is just a great thing to do. In presets, we already have it there. So you can find your left brain combo right here. So I'm going to go to settings, and then I'm going to go to the bottom, and I'm going to save it as left brain combo, and I'm going to hit save. And see, it's still blue. It's got to go green. As long as that doesn't go green, it's not safe. So now it's saved. Okay? So now I'm going to go over to my saved exercises, and I've got, I'm building up my maintenance folder. I've got my left brain exercises now, and this is a combination of saccades and pursuits in a diagonal plane, which is great for the left brain. Now at this point, if there's still a hemisphericity, you can keep it one side or the other, but if they don't have it, then you want to activate both sides. So you also want to run a left brain exercise too. So I'm just going to switch the direction here, and I'm going to go to the bottom, and I'm going to save it as right brain combo. Save. Gotta go green. There we go, it's green. So then I hit done, and I want to go back and see, make sure it's there. And there we've got our left brain and we've got our right brain combo. Okay? So again, you do your gaze exercises first. Here, with your one no and yes at each time it moves. And make sure that quality of that movement is really good. Focus on quality. Then we do vergence, working convergence. Then we do circular pursuits. Cover all the, we activate every muscle in the eye. And then we can even do it, this is optional, you can do it as it's diverging and converging. And then we've got the left brain and the right brain exercises. Okay, now we're going to add two more. The memory saccades and peripheral vision. We want to do something for the peripheral vision. So the memory saccades that we covered earlier would be a great addition here. So again, you would create a setting in there that's challenging, that's hard for your patient, and then save it, put it in that folder, and then you add the peripheral vision exercise, something that's hard. And it may have to be moving targets, and it may have to be a lot of them, and make it challenging so that they can keep exercising their brain. And let your patient know they need to come in and check in with you every once in a while so that you can upgrade their exercises. Now, I think that's a good amount, because if you give too many, they're gonna skip them frequently. So you want to make it just enough so that it's not too much. And you might even want to tell them which one are the most important ones. There may be some in there that you might decide to skip. Now, you can add in more as well. If they're the type of person that's like, give me everything you can give, I can take, give me more. Then you can add in a metronome, to the combo saccades and pursuit, and you can add in anti-saccades as well. So you want to really build up in the maintenance. Don't be afraid to really build up those executive centers. And that gives just a lot of empowerment to the patients when they know that, okay, they've done a lot of great work with you. Now it's time for them to be at home more, be in your office less, maintenance, build up some strength in your brain. Come get rechecked every once in a while. We'll rerun a new test, some new assessments, and upgrade your exercises. So, and there it is.